I've been in the island for about 13 years, and I've been working with Simone since they were officially registered with Lemonade BVI. I just found that out yesterday. I thought they were just, new, 2 years, but then they have been functioning for about 7 years already, correct?
Since 2018, that's right.
Yes. So before I start, I know everyone has an idea of, has heard a lot about ADHD. I just want you to do a visualization for me. So let's imagine a kid in class, at home, a friend of our child, very restless, very fidgety. When he plays, very rough, likes to push things, very careless. And we start to feel a way about that child, what's happening? Why is he acting like this? In school, grades are not good, but we know he can do better. The teachers would always tell us that, your child is very intelligent. I know he's very creative, but he's just not able to finish things, or he just couldn't focus. Then fast forward 20 years after, this child becomes an adult. Adult who forgets anniversaries, who may not be listening to the spouse, who may not be able to finish emails, answer emails, or get a lot of work and not finish anything. These are the phases of ADHD. We all know that ADHD is very common in children, but very few people would know that ADHD transcends up until adulthood. And that's what I'm going to be talking about today. Next. So these are my learning objectives. Simone has a document of my lecture, so I'm going to breeze through because I only have 20 minutes. So my apologies for that. If you do have questions, feel free to ask. But don't worry, you're going to get a copy of it once you register and you have your email with Simone. Now, we all know the definition of ADHD. There should be inattention, there should be hyperactivity, or a combination of both. I forgot to put here impulsivity as well. It's a neurodevelopmental condition. It's not a brain damage. It's a difference in the brain functioning and brain maturation. All right? And as I've said, it may persist in adults with some shift in symptomatology. It's very prevalent in children, about 8%, but boys are more commonly diagnosed than girls. It is because boys present with more symptoms of hyperactivity. So if a child is very quiet in class, we wouldn't really be, paying attention about, this child is very disruptive. But if a child is, talking while the teacher is speaking, then it catches our attention. So most of the time, girls are diagnosed later because the girls would manifest more inattention. Therefore, it would reflect in school grades or school projects until the teacher would notice that, hey, this child is not functioning as what she's expected to. Then that's when, people would start to realize maybe she needs to be tested. Now, what causes ADHD? It's a multifactorial cause, but we have to bear in mind that this is a heritable disease. About 74% of children that has a diagnosis of ADHD would have a parent or a relative with ADHD. There's also a lot of studies based on imaging that there's a factor of brain structure and function. So when they look at the imaging, they would notice frontal lobe changes, basal ganglia and cerebellum. I'm going to discuss this later on as we go through the different stages of growth. But it is definite that there is a change in the brain structure and the chemicals of the brain that affects the way these children or the adults manifest symptoms. And lastly is environmental, like for example, premature birth increases the risk of ADHD, or prenatal and early childhood exposure to toxin. And toxin would also include alcohol, cannabis, and all the other recreational substances. Now, let's start. So what happens to the brain of a person having an ADHD? So the prefrontal cortex, so if this is our brain, this is the frontal cortex, and then you see my knuckles, that's the prefrontal cortex, and it has both sensory and motor. Um, so the role of the prefrontal cortex is for attention, planning, impulse control, and decision making, and they found out that there's a delayed maturation. So there is a reduced volume in the brain of a child or a person with ADHD. And these findings would correlate later with, how they function. In the basal ganglia, so this is the brain, the basal ganglia is over here, right, at the base. And it's responsible for motor control, habit formation, and reward processing. So they found out that the connectivity between the prefrontal and the brain, the basal ganglia, there is an alteration of the connectivity and reduced volume. This would have something to do with the neurotransmitters, which I will explain later. Now, there's also a dysregulated reward pathway. If I may ask, are we familiar with the reward pathway of the brain? So the reward pathway of the brain is a center in our that is activated when we experience pleasure. So what are pleasurable things? When we receive a gift, no children, right? When we're having sex, when we're taking drugs, those are, like from our senses, it goes straight to the reward pathway, and the reward pathway will say, oh, this is nice. And then the reward pathway will now send the dopamines, and then we will feel good. And then it's a pathway because it will go back, because it will reinforce itself. So once it's reinforced, it becomes a problem in certain pleasurable activities, because like, for example, drugs. That is also the theory behind addiction. Why do we get addicted? Because the reward pathway is activated again and again and again, and now this reward pathway is now seeking pleasure. Where is my next ecstatic experience, right? So with the brain of the ADHD, the reward pathway is altered in such a way that it needs more dopamine to get satisfaction. For it to be, so for example, why is my child able to play or do video games 4 hours and not do a 15-minute homework? Because the dopamine released by the video games is more than a dopamine released by doing homework. So meaning the threshold for the dopamine is higher for things that are not interesting to them. All right? So, and of course, the delayed brain maturation and neurotransmitter differences. So this is the tenet of medication, the number 4 and the number, the last 2 ones. So that is where the medication is based. Those are what we are targeting. How do ADHD brain think? So we remember that when we are children, we are driven by reward. Everything is driven by reward. If you want a child to do something, okay, if you do this, then you'll get an ice cream, and then they will do, correct? So with children with ADHD, as I've said, you need to provide more reward because they need more dopamine so that a task can be done. They think in bursts, and emotional reactions are fast and strong because the connection with the prefrontal cortex and the motor, which is the thinking and the behavior, is altered. They have trouble doing multiple steps because the prefrontal lobe is not working well, such that the concentration and the focus is also altered. Examples are these ones, they can build Lego for hours and not be able to finish homework. You can get frustrated because they will have meltdowns over simple things. They need constant movement to think, fidgeting, like tapping and all that. How does it manifest in behavior? So I'm sure you're very familiar with these behaviors, right? Careless mistakes, forgets or loses things, moves from one activity to the next without finishing. We provide them safety because we know they will run, climb, or just dart in to the streets or like talks excessively. So these are the observable symptoms in children. But beyond that, we need to know how it affects their domains of personality. Like, if the brain is always active, and we know that children are very curious, creative, and as I've said, most children with ADHD are very intelligent, why is it not translating into the work? It is because they get easily distracted. They want to do well, and they know your expectations of them, but they are not able to translate it into actions. And it leads to frustration because, my teacher or my mom thinks that I'm not good enough, correct? Because, I'm not able to finish things. Children, 6 to 10 to 12, all right? How it affects them academically, of course, there's problems following instructions, completing homework, sitting still in class, and the parents would always hear the teachers say, they're very bright, but they're careless, or they're not trying hard enough. And this becomes the label that the child would be able to remember, right? So emotionally, they would be, of course, feeling troubled. Why am I like this? Why am I not like my seatmate? Why is he able to do that and I'm not able to do this? And the frustrations come because of those changes or differences that they would notice among peers. It will make them sensitive to criticism. So every time they would hear that, it becomes now a judgment, and then they would act out. Socially, because of the interruptions or the impulsivity, they have a hard time maintaining friendships. Why? Because they can be seen as bossy. They can be seen as rough, right? Too hyper, it's too much activity. Like imagine sitting a hyper child with a quiet child. Just visualize that. And eventually it affects their self-image. Because they always think that they're bad, it makes them feel stupid. Forgive me for saying the word, right? But you know what I mean by that. So self-esteem drops early in childhood. Now, as I've said, the relationship domain is also affected because when they play, they would grab other children's toys, they would blurt out sometimes unnecessary comments, they may be overwhelming to quieter playmates and may cause disruptions and conflicts during class or plays. This make it difficult for them to keep friends because they may be excluded from groups. You know how children are, they sometimes work in cliques, right? And it gets worse in teenage years. So they would feel misunderstood, and as I've said, it affects their self-esteem later on. Okay, so I'm gonna fast forward. So we have adolescents, so where the motivation becomes even more reward driven. So the adolescent, so from pleasure principle to reward driven. So for example, your teenagers, how will you make them do the chores? Aside from, like corporal punishment, right? We need reward. We need to tell them, okay, you can, go out with your friends after you do this, right? And these are the things that are happening in the brain of the adolescent. So they lag behind peers because they have delayed executive function, and they usually take more risky behaviors because they crave stimulation and novelty. And these are the examples. As I've said, you will be able to have a handout of it, okay? Now, the reason for this is because the reward system matures faster than the prefrontal cortex, meaning the I want matures first between the, okay, maybe not now. And these are the observable behaviors, like you can see it all the time with children with ADHD. Now, I just want to focus on how it affects development of the adolescent, because remember, adolescent period, they're they're very sensitive to criticism, and this is the period wherein the peers, like what their peers say is very important to them. So, an ADHD child who is in an adolescent phase, who struggles in planning, making assignments, consistent studying, they now feel that they are not at par with their peers, so they compensate. Okay, maybe if I'll be funny enough at school, then maybe they will like me. So you would see them being the joker of the room, or like, maybe I should just not do anything, I'll just withdraw. So the extremes in the reaction is because they are seeking for something that would give them what they want. Remember, reward. Like, for example, if attention is the reward, if I make a funny joke, they might laugh and, I get the attention. Or if I don't do this, maybe they will like look at me and say, okay, hey, how come you're not doing this? And then they get the attention, all right? So they don't do it on purpose though. It's just how their brain works, all right? Strong mood. Why is my teenager always angry? Strong mood and mood swings are very common. As I've said, how it affects the relationship. Other adolescents may find them too intense, too active. In the family, parents get frustrated easily because, this is the time that you should be able to do this. Why aren't you still doing this? So the frustration develops and the self-esteem suffers more. Okay? Now, let's go to the adult. This is a topic that I don't think is discussed a lot. Now, adult's brain works as interest-based motivation. Not importance of or obligation as what we all would think. Interest-based, ADHD brain. Meaning, I like watching action movies. You go on a date. The movie is a romantic comedy. He would do it because maybe he likes the person he's with, but the focus and attention is not there. However, if you go to an action movie, then you would see him very engaged or her very engaged. At work, he or she would do things that would interest them, but not things that he's obligated to. So you would see him struggling with a lot of things that he wants to do and not being able to finish most of it. So he would go from one task to another because it's an obligation. Like if you're given work in the office, you would need to finish it. But then the interest part overcomes the obligation part. So he would wait a last minute until he does like doing the slides. I waited the last minute because I wanted to play tennis. Right? So that, and thank you, Simone, for doing the slides again. I'm almost there. So observable chronic lateness, missing deadlines, poor organization at work, impulsive purchases, switching job frequently, interrupting conversation, and unable to manage finances or stick to the budget. And this is most important because, like the adulthood is even longer than the childhood experiences, even though, that is the basis of our main behavior. The most important thing here is the effect on the work and the career because, as I've said, people with ADHD have difficulty prioritizing tasks, and the boss would say that, you're a good worker, except that, I can't count on you on, finishing certain things. Or you have so many ideas, but you're not able to put them into action.
Well, Dr. Turner, I just had a thought.
Yes.
This is my ADHD speaking here.
Uh-huh.
We have another segment, and I'm going to invite you to stay on here with us. It's a panel discussion, and I suspect a lot of what you're going to say here is going to come up in that conversation.
Oh, yes. Okay.
Are you okay with that? I know I'm putting you on the spot.
I know, right? You told me that already.
Are you okay with that?
Okay, I can sit here and then,
Yeah, and you can leave the slides up, and
All right, no
problem.
problem.
We'll open it up to questions, of course, from the audience. But just in the interest of time, because we have a lot of really
Yes.
good stuff, just like what you're doing here, and
All
we
right.
want to get to it.
Okay, so we
Yep.
will stop here, and then as I've said, you have your documents with you. Later on, don't forget to remind Simone so that you can continue with the rest of the lecture.
Yes. All right. Thank you. All right. I'd like to invite the panelists to the stage. The next segment, we're going to have a conversation with Dr. Josephine Claxton-Richardson, Apostle Foy, Dr. Mike, he's here, and myself. Thank you all for being here today. So this one it's going to be interactive. It's spontaneous. They don't have any of the questions ahead of time. They're not prepared. But I see somebody got their laptop here because, you know, we know Dr. Josephine, how she rolls. All right. So is it just, so the question is, I'm going to just put it out there, is ADHD just an excuse for bad behavior? So we just all saw what Dr. Turno has there in his presentation. You've heard the stories of that kid that just always in trouble or just won't shut up in class. There's always something happening, and then you get the eye roll from a teacher or somebody when you say, well, actually my child has ADHD, and they go, yeah, there they go, making an excuse for that behavior. Is it really just that? What have been your experiences with that? And I know, Apostle Foy, you and I, we spoke at length about this in the past, about your own personal experiences, and I would love for you to perhaps start by sharing a bit of that with your experiences personally with your family and things like that.
Okay, good morning, family. She put me on the spot. So, so again, ADHD, as we heard Dr. Turner shared, I grew up with it. My brother that was immediately behind me was diagnosed when he was maybe 8 or 9 with ADHD. And so when I went to university and I studied counseling, as I studied counseling, I understood myself. And I understood my brother and I understood my family. So as my teacher taught different things, I understood. I said, oh, that is why he did this, why he did that. A lot of times, so a basic overview, ADHD, a simple term, it's how they receive information, process information, store information, and share information. So they process and share differently. A lot of times we call them rude, disgusting, unmannerly. These are the words that we will use in our community. And that is what I thought of him as well. Were you so rude? Were you so disgusting? We grew up in the same house. Well, you have to behave like so. So even in addition to that, being a teacher at Agape Total Life Center last year, I taught 7th grade. And in 7th grade, one of our students was ADHD. So it took me back to university because I had to pull on all of my old knowledge to help this particular student. I want to say in starting that ADHD is not a life sentence. Persons who born or diagnosed or even undiagnosed with ADHD grow up to lead normal lives. A lot of time they're the leaders, entrepreneurs. They think out of the box. And God, as a Christian, I have to say, God has a plan for every child, including those that are ADHD. I'll just put a note there. A lot of times what we don't look at with ADHD is the procrastination. So procrastination is one of the symptoms as well, and I can say, well, then I am ADHD because sometimes I procrastinate. When I think some task, when you think about it, it's like you have to climb a mountain. It is so hard. So you have the problem with even initiating stuff. So it's not that you can't do it, but you think, oh, I have to start that. And just to get it started, so you call those children in school, they say they're lazy. They're not lazy. They just doesn't have sometimes the ability. Again, how their brain works, how to just initiate. So sometimes initiating things are a problem. So I will stop there because I can talk a lot sometimes.
Thank you. All right, so I'll invite Dr. Josephine. Do you have any comments in your experience, in your practice? Have you heard, I'm sure you've heard this a lot. Do you have anything you'd like to share?
Good morning, everyone. It's difficult for parents, and it's also difficult for teachers in the classroom. For parents, they are often seen as the ones that can't control their child. There's that child in front of them that you don't know what's happening, they get in trouble at school, they're disruptive, they might go out and have antisocial behavior sometimes. And it always comes back to, we say this thing, what do we say? Charity begins at home. And so often people feel they've not been taught anything in the home because they're not sitting still in the classroom. So I want to share a case scenario that one of the parents who came to the center. She came to the center, she was breathless, she was anxious, she was frustrated. The child had been diagnosed with ADHD at the age of 7 and was on medication from the doctor. When he came to the center, he was older than 7, and the teacher at the school said, you need to go to the center, your child's got autism, he's autistic. Now, one, the teacher should not be diagnosing anyhow. The child already had a diagnosis that he had ADHD, was on medication. But the mother, although he was having the medication, during term time, she would give the medication. Outside of term time, she would stop the medication. A, it was expensive, so for her that was an issue. B, she wasn't sure whether it was working, she felt that it wasn't working. So you can see the inconsistency. Gets it term time, outside of term time, no medication. So then when he goes back into school, his behavior is back to all over the place. Not sitting down, pacing, talking to his mates across the way, and disrupting the teaching, learning. So you can see there that the parent has no idea what to do. I need support, I need help. Where do I go? Who do I turn to? So there's a thing that we need to make sure that our parents really understand, and the teachers, that the child is not being disrupted. They need the proper support and navigating to the right sources of support. Whether it's medication, whether it's talk therapy, the child needs something. But we shouldn't always pass judgment. We need to find out whether it is ADHD and not think it is a behavioral issue. We know that within ADHD we have the behavioral things, but we also need to make sure that we're consistent in the way that we do treatment.
Thank you. That's so relevant. And you touched on something. I looked across to Dr. Turner and he saw me look at him because we have this conversation about medication and how do you manage this. As a psychiatrist, someone who actually prescribes it, do you want to comment on that a little bit for us?
Yes. So first and foremost, with children, we start with behavior therapy. That is established, okay? Because we need to make sure that there's a behavioral part of the treatment, because later on the behaviors are going to be the structures that they will be following to help them organize themselves and to help them coping with the other difficulties of life. The medication will not help them with the difficulties in life. The medication will help them focus so that they will be able to do the things that they need to do basing on the behavioral or the therapy approach. For parents, we have to remember, well, for parents who are in the know, we have to remember that the medication has a limit of effect. And for those who don't know yet, I'm telling you now that when we give the medication, it only lasts for a few hours in the body. So there are two types of medication. One is the long-acting and one is the short-acting. It lasts approximately 4 to 6 hours. The most is 8 hours. So when you give the medication in the morning, it helps them with school. At the end of the day, it's out of the body, so you wouldn't really be seeing the effect because the medication is already out of the body. So when you say that, oh, my child is still restless at home and fidgety, that is because the medication has only worked on those hours. Now, what I would tell the parents of my patients would be, okay, maybe give it on a weekend so that you'll be able to observe how the medication affects them. The second thing is the dosaging. Sometimes the parents would come and then once the dose is given, there is no follow-up. We have to follow up because remember, when we put your children with medication, we put the lowest dose for the meantime because we are weary about possible side effects. From then, we see them more frequently to build up, to know at what dose they will be able to function as how we want them to like focus well, sustain the focus and attention in the school. Once we have that dose, then we just keep the dose. And then as the child grows older, there might be an adjustment in the dose because of the body surface. Like, as they grow older, bigger, taller, they might need additional dosaging. And there are two types of medication. There's the stimulant and the non-stimulant. What is available in the island right now, unfortunately, are the stimulants, which are methylphenidate and Adderall, in very short supply sometimes, but it's there. The non-stimulant would be the tamoxifen. We have the clonidine and the guanfacine. But we don't really prescribe them because you have to pre-order it. So if there are parents that wants it, I would tell them, okay, we have to speak with the pharmacy and then you can just pre-order it. But there is a non-stimulant alternative. For some parents, I do tell them about some herbs that have been found to be useful for focusing. So like Brahmi, rhodiola. There are supplements like L-theanine that can help with the focusing. There are studies backing it, but in some children, it's not enough.
Thank you very much. And we have my friend and colleague, Dr. Mike. I say colleague, I mean colleague in ADHD because we both live with it. And so I'm going to shift perspective just a little bit and ask him just to, we're talking about, the question is ADHD just an excuse for bad behavior? And being in church, I often hear you talk about, so you share some of your stories from your childhood when it all became clear later in life why you were the way you were. So if you'd like to share as you're comfortable. Yeah.
I like the question in terms of how it's phrased because it's very provocative. It's the assumption that people with neurodiversity are behaving bad. Bad behavior is bad behavior in terms of whatever your scope of what bad behavior is. And that is very relative depending on culture and household. You will see oftentimes people who are neurodiverse tend to be, as you well know, are successful, take chances, they take risk, they're able to manage a lot of multiple projects and things of that nature. But when you're younger, in classrooms especially, for example, growing up, I was often labeled as that I talk too much. But if it took maybe till I was doing my doctorate for people to really understand that what was happening is that most persons who are neurodiverse tend to be more intelligent or have a high IQ. And oftentimes they will get bored in class because if they're sometimes, like I just speak for myself, that you already figured out everything that's going to happen in the class that day, and so you've shifted your attention to something else. Now in the classroom, that is not, most classrooms, that is not it's frowned upon. So you'll be labeled as talkative, you may be punished, and teachers now, I guess hopefully, are more understanding that to identify the strengths rather than looking at the weaknesses of not being able to sit down for a 45-minute or hour and 15-minute class. For example, like the job that I have as a psychologist and a business owner, if I didn't have that, if I had to sit behind a desk and a computer all day, I mean, sorry for people who do that. But the thought of it drives me absolutely crazy. And that has to be okay. So then we have to have differentiated learning so we ensure that people are not being labeled as bad when they just learn or think differently. So our education system and even in our homes have to create environments where you could foster it and that person is not being punished for something that they ultimately can't control.
Thank you. That is actually, you hit a lot of nails there on the head. So we've said a lot. At this point, I'll just like to open it up to the audience. Are there any questions or comments you have on ADHD? Just one sec. We'll get a mic to you. Yeah.
Good morning, everyone. So I heard all of the symptoms. Can the symptoms manifest in other ways, like depression, or maybe the child can have opposite behavior, like maybe be extremely quiet or extremely disconnected? That's something, because I've seen children have the complete opposite, just complete disconnection, just lack of interest. Or so, can you elaborate a little bit more on that type of behavior?
So from a clinical psychologist perspective, in terms of what may be seen as lack of interest, it does happen. So sometimes, most of the times in young girls, ADHD manifests a whole lot differently, especially in a younger age. You won't see the hyperactiveness or the physical fidgeting, but they will be sitting there seemingly not displaying any bad or disruptive behavior, but not engaged at all and distant. And also, if a child is being labeled as bad or disruptive and being told negative things about who they are, then you'll see the other symptoms that will come across, like they'll be anxious or sad or withdrawn because they don't feel welcome in an environment. So it's usually some of these things are called secondary symptoms that are caused by a primary misdiagnosis or misunderstanding of that child's display of behavior. And even now in adults, what we've noticed, even from these seminars and more education, we're seeing adults coming in to the clinic for the first time in their 20s, 30s, 40s, finally being diagnosed. And I've had a lot of experiences in the office where you see people who've come in feeling anxious or depressed as their primary reason, but when you talk to them in their lives and they're struggling at work or in their families, you see that they've been struggling with a neurodiversity for all their life, and being excluded has caused them to feel these symptomologies. So, these depression and anxiety can be formed, and mostly formed primarily by chemical imbalance, but it can also be formed by communal or outside pressures. Yeah.
Thank you.
Thank you.
Good morning, everyone. Just a quick question. I have a female around 9 years old. I'm trying to describe what the teacher told me. So basically, she does her work. She's focused. The teacher says she cannot critically think, comprehend, but she managed to do her spelling, everything. She focuses on the work, but then a particular time she has to move. Whether it's shaking her leg or she just gets up, she walk around, then she come back, she sit down. But they're telling me maybe she needs to get checked out. So I'm just wondering about that.
Okay, so there's a slide that I flashed wherein children with ADHD, in order for them to think, they need to move because there's a sense of inner restlessness. Testing is very important. I believe that the children should be tested. One, for their IQ. Number two, for other things like ADHD or other things that we'll be able to manage, because being able to know what's happening, we will be able to start early, and for them to be able to develop early coping mechanisms. Now, with children, remember, with ADHD, most children are very intelligent and creative. It manifests where the workload is more than what they're able to handle. So, for example, somebody with ADHD might get a high grade, but going through high school and college, he will not be able to manage the workload anymore because the capacity is not enough to handle more stimulus. So it may still be, there's no harm in testing. If it's negative, then that's good, because there might be other approaches that we can do for the child. But if it's positive, then that child will be able to benefit from either behavioral therapy, cognitive behavioral therapy, or medication, which I assure you would change the way she would view herself, and also people would have a different view of the person. I have a child who was referred to us who was reported to be ramming himself into objects all the time, and you know, he was referred because he expressed wanting to hurt himself. But you know, I feel on initial observation that he has an underlying neurodiversity. But these children are only referred once they do something bad or something that is scary, but it doesn't have to be.
Okay, can I just add to that as well? For the student, even for the teacher, sometimes the child could be overstimulated or understimulated. The child could be challenged too much or not challenged enough. So if a child is not challenged enough, the child then become bored. Again, he or she is able to rapidly finish the work. If it's too much, it would then be that the teacher needs to, and again, that's why it's good for education. Start chopping the work up in small bites. In addition to that, giving extra breaks. Like I said last year, I taught a child who was, ADHD. I understood the child, so I didn't give extra breaks. For homework, sometimes you teach the same concept, and say, example, everybody else got 10 questions. I can say, okay, you taught the same concept, but I can give you 5 to 7 questions. So you make it smaller bites, you give more breaks. They need structure. They need stuff done the same time, the same way. So sometimes, again, the partnership with the parents and the teachers, structure at home, they need calendars. I remember timers. That's something that Sister Simone is big on. Put timers, 10 minutes, 15 minutes timers. And those kind of stuff can help adjust. Of course, they need testing. But in addition to the testing, there needs to be a partnership. The parent needs to talk to the teacher parent sharing information. And again, structure. Sometimes at school, the children have structure, but at home, there is no structure. So that causes confusion and an ability for long-term help.
I'd also like to add positive reinforcement. I think one of the things we do focus a lot is on the negative, but if we can actually look at the things that they're doing well and actually give, reward them with some positive praise, affirmations, something like that, so that you can take the focus away sometimes with, you're not sitting still, you haven't done this properly, get you out your seat again. So try and capture those times when they are doing something that's positive and give that positive reinforcement and also the emotional support as much as you can.
Well, thank you. See, there's a question at the back.
Good morning, everyone. Just to take the conversation briefly out of the classroom, I just wondered about how ADHD manifests itself in a child playing a sport. I know that sport would be important for any person, any age, but I just wondered about what kind of symptoms would you see manifested in a child playing a sport, any sport? How would it be recognized?
That's a really, so on a lighter note, first just make sure the child is good at the sport. Okay? If you suck at basketball, you're just not good at it. If you're not good at soccer, you're just not good at it. If your parents have never played a sport, you're not athletic. That's not a symptom of ADHD. Second to that, I just want to say, because sometimes we overanalyze situations. Maybe you're just not good at that sport, and maybe you should just play Uno. But in terms of that, like in my years of doing this, children with neurodiversity tend to thrive in sports, especially most of the times in neurodiversity, they are high in visual spatial learning and skills. Visual spatial skills is what you exactly need in being able to analyze sports. How far, if I kick this ball, where it's going to go to, what's going to happen next, predictive learning. The only time that I could see a negative symptom of that manifesting is in the impulsivity. That in sports, if you get high emotion, one of the negative symptoms is the impulsivity, so you may act out in extreme situations more than others. However, it is shown that physical exertion tends to be a calming effect for ADHD and not usually a negative manifestation. So you will never know that athletes who are able to keep going, don't get tired, get energized by playing more tend to be more successful.
Can I just add to that as well? When you talk, I thought about this. It would then be, so the child is always doing extra. So they said we're running 1 lap, but that child wants to do 2. They always want to be in the front of the line. Sometimes they don't take instructions well, or sometimes they get agitated very quickly, and then that might, cause fighting or pushing and stuff like that. Some of those things, but like Doctor said, it is imperative and necessary that exercise, it helps to regulate their hormones, their emotions. It is that those things are very good for them. So getting them into that will truly help the family, the class, the community, all around.
Wonderful, thank you. All right, so we have about 10 more minutes in this segment. Do we have any more questions? I see one
So
back.
I just have one question. So we preach about, or we say about structure for ADHD. So Daddy and I have a child, she's 8.
Mike.
She has ADHD. We also have a kid who has autism also, and then we have a small one. He's normal, right? So not all the time that we can get same time to do this, routine from a Monday to Sunday. And therapy would say structure, have her do this time and time. And we have a chart that one of her teachers in school made for her, which was excellent, but she doesn't follow that at home. We will follow therapy. We would write at therapy. We would follow the instructions at therapy. We will follow the instructions in school. We feel safe with one teacher at school, and they will go to that one teacher and express when they're overwhelmed, and she will help them, which is amazing. But when it comes to home, and Daddy and I are trying, because we are being pulled 3 different ways, right? Well, 4 actually, because, I'm trying to get dinner done. Daddy's trying to help get them to, have a shower, settle down. How do we move, or what other can you suggest besides this structure working to help her move, to help her progress? If you understand where I'm coming from.
Yeah, I get what you're saying. One of the first things I would say, raising several children with differentiated abilities, and I know you didn't even intend any harm by saying that one has ADHD, one has autism, and one is normal, because I'm sure the one is normal ain't really normal, just as you who may not be diagnosed.
No, he bounces off the walls. He's a one little monkey.
Yeah.
He bounces off the wall.
I would say to parents, you have to just be okay to knowing that what you're doing is enough. And you have to be able to manage your anxiety and your burnout. Because I can't tell you to do something else other than what you're already doing. Because it is shown by studies that structure is important. But if the parents are stressed out, burnt out, and tired, so you have to put structure and also place time in your schedule so you could be reflecting that level of calm that you want. And so what I would say, if you want to do anything that is most impactful to that child, is model the behavior that you will want them to exhibit as well. So when you're finished with structure and you feel like you're getting burnt out, being able to tell the child or yourself, hey, mommy or dad, we need a moment. I know you may not understand, but I need a moment too. And you structure non-structured time into that day as well. The reason I'm saying this is that we have to be mindful of our expectations of what we can and cannot do. I remember as a young graduate resident, I had all of these amazing treatment plan goals, and I became really disappointed because they weren't being manifested. And my supervisor came and says, sometimes you showing up and providing a place for a patient is good enough. And you being able, a parent, providing a safe environment for that child is therapeutically doing more for their long-term benefit than the immediate effect. This is a long-term game, and I know it sounds like just, when you're in it, it's hard, but it's a long-term game. So we just have to continue, what I would say, continue to recapture and re-envision what it is that you're expecting. Not that you're lowering your standards, but you're being realistic of what the goal really is, and being able to be patient in that process. I know it sounds like a whole different direction, but I'm not going to tell you another magazine or another thing to try, because I'm sure you're already mindful of that. I will just say, just continue to reflect, give yourself some space, so you know, and encourage yourself that you are doing the best job that you can. And the point that you are here, and you were here last year, because I remember you, that you were doing more than enough. And sometimes that's good to help lower the anxiety and the pressure in the house, and say, hey, we're doing the best job that we can, and at the end of the day, we love you and we love ourselves, and that environment helps that child build a safe emotional environment and will allow them to become a healthier adult.
Thank you, Dr. Mike, for saying that. And it actually reminded me of something I'd like to share, Candace. I might embarrass you a little bit right now. Before I knew you, I remember walking, I think I shared this story with you already. I was walking through Right Away supermarket one morning, and there was this family by the orange juice, by the orange juice section, having a very heated debate about whether they're getting orange juice with pulp, they're getting the orange juice with the I remember this vividly because it was beautiful the way they did it, okay? The children had their opinions and they were expressing them very clearly as what they wanted. Now from a different eye, it would appear as, but why them so rude? Why are they talking to their mother like that? Why are they talking to their father like that? But I did not perceive any rudeness in what was happening, because what Candace and her husband were doing, they were talking to their children and not talking at them. They were not shouting and yelling at them, but they were so vibrant. It stuck with me. And so then when she showed up at the Lemonade meeting, I thought, okay, I get what's going on here. Not trying to put any labels or anything, but I really appreciated that. And you should know, I'm giving you your flowers now while you can enjoy them. You are doing it. You are creating that environment where your children are confident to express themselves to you, to any adult for that matter, because they do it with me. They are confident people that you're raising to put into the world, and you and your husband should know this. And so thank you for the effort and for showing up, as Dr. Mike said, to these sessions and learning more and asking the right questions. So I'm gonna put that out there. Just take that with you for today, all right? Let's give her a round of applause. I think we had one more question on this end, and then Dr. Josephine is gonna share a poem she wrote with us.
Hello, morning everybody. My name's Erin. We have twin boys, they're 6. One of them, the twin 2, Finn, he has autism and ADHD. So his autism is level 1. And then our other twin, Indo, he doesn't have any neurodiversity. And we're doing okay, but one of the things that is really challenging is that at night time, Finn, he has trouble sleeping, and I understand that's normal. But also now Indo wakes up as well, and they're both actually quite emotionally dysregulated at night time. And so they just want to be with us, and they want to sleep with us in our bed at night time. And it's really, really challenging because it affects me mostly because they just want mum, So it's a sort of this co-sleeping situation. And we've tried everything. We've tried, okay, back to bed, everybody, okay, back to bed. And we're so exhausted that in the end, you'll just do anything to get sleep. So it's in a way, it's like having newborns, and it's really hard. And I just wonder if you have any advice for us.
Doctors?
So Dr. Turner do the medical aspect, as he just said, because, and this is a benefit. I'm not saying this just because he's here. Dr. Turner and I have been working together for almost 8 years now, and it's the benefit where you have a clinical psychologist and a psychiatrist working together to come to a solution from different perspectives. So what I will say is the behavioral therapy, how old did you say they were? 6? Okay. So with chronologically, yeah, they're 6 and they should be at that point of sleep with themselves. But if we would do a developmental age or testing, we'll see where they are. So they may be a little bit younger in terms of the emotional safety of going to bed alone. Going to bed alone creates a lot of anxiety in children. And so when you exacerbate that with a diagnosis, it makes it even more difficult. So we will have to start with consistent, small behavioral, even if you start off, for example, and this is broad because it will need to be more specific to the situation, but starting off with incremental exposure and allowing them to sleep. Say if they sleep one night at 30 minutes, if the goal is 30 minutes to an hour in their own bed, that's a victory. It may not be the best, but it's a starting point. And then we go to an hour and a half and use positive reinforcement and things like that to help encourage that behavior, to reinforce that behavior. Being tired and just wanting to go to sleep is not you giving up, it is being tired and wanting to go to sleep. Unfortunately, it does negatively reinforce them being there. I think them wanting to be in bed is more so about safety and them wanting to feel emotionally connected to you all rather than just trying to disrupt your sleep. So I think starting off with incremental exposure of 30 minutes with positive reinforcement and find out what things you could use that allow them to reinforce behavior will be very beneficial. And using it at 30-minute increments over a 6-week period, but not letting them know we're going to do this for 6 weeks because they're that young. So you need to do it 2 days at a time because it will be too much for them to envision doing something for 7 days. In a short nutshell. Yeah.
Okay, so I will be answering that as a medical doctor, all right? It doesn't in any way mean that we go to medications right away. Because I know a lot of parents, when they go to psychiatrists, they would think, oh, no, he's going to be given medication. Behavioral approach is the first and foremost, even in young children. In fact, I don't start or advise medication before 6 years old. So unless the parents really like, Dr. Turner, I've done everything I can, can we start on medication? Then we start on medication. Now, for sleeping, that is one of the most common problems with children, among children with ADHD, because they still have this like bursts of energy. And as I've said, you may have noticed emotional regulation. So medically, firstly, I would advise for like the adaptogens, like melatonin. We start with that, and then we start with the mildest, which is cyproheptadine. Cyproheptadine is an appetite stimulant. So it is marketed as Apetens or Anorexan in different countries. It's an antihistamine. It's used for allergy. It's used to increase appetite in children, but it also is sedating. So when you give it at night, it helps them with the sleeping, if the melatonin doesn't work. So from the mildest, the milder, now we go to another medication, which is called clonidine. Clonidine is an alpha, well, it's a hypertensive medication for adults at a certain dose, but it is also an ADHD medication for children who is having problems regulating their sleep at night because it's sedating. So we put the child on a low dose of clonidine at nights and then maybe a methylphenidate in the morning to cover all the symptoms.
So how Dr. Turner and I will treatment plan around that, for example, is that say if you start on melatonin, which is a natural vitamin and mostly acceptable for parents, we will say, okay, you're starting on this dose, and a behavioral therapy will be, hey, we're going to take our nighttime medication now, and our goal is for you to sleep in your bed, and we're going to try to see if we get a half an hour sleep. And when they get that, And even in the morning, if they wake up in your bed, you're like, wow, you did an amazing job. You slept for an hour in your bed. So what you're doing is training the behavior to be in their bed while using the aid of helping them go to sleep. And so it reinforces a positive behavior. So now that child is being successfully trained to be in their bed, being emotionally safe while having a chemical medication aid to assist in helping them get towards the desired behavior. So when you combine those two together, you're doing it. So for example, if you just give the medication, there's no behavioral target, there's no behavioral positive reinforcement in the morning, the medication is just used that they'll fall asleep anywhere, and it's not reinforcing the behavior, because over a period of time, they will start to get sleepy in their bed, because now they're being trained, just like with the reinforcement, being trained to be that this is a place that they go to sleep, and after a while, you will be able to taper off the use of the medication, because now when they see their bed or their room, it creates that natural sedating effect.
Can I just take 1 minute? I'll just like to add to what the doctor said. I would say something we can add to, you're probably already doing it, transitions. You know, transition in children is something that's very important. So transition, so say example, you transition in the morning, you get up, when you get up, the things, you get up, you brush your teeth, you wash your face, you say your prayers, transition in, get ready, we're going to have breakfast. And these cues help to remind them, help to cue their brains as well. In the evening after school, we know we come home, we're going to wash your face, sit and take some time out, do some playing and whatever. Then we're going to do our homework. And then you start, like, in kindergarten, that's it's clean up time, it's clean up time. You start developing a song or something to do that everybody knows it's time for bed. This transition, you start talking to them about it. You go into the room, you say, this bed is so soft, I like your comforter, we got your favorite blanket, whatever, favorite squeezy stuff. Again, transitioning their mind. You do it over and over continuously. These transitions to help them to, and you can lie with them, this bed is so comfortable, this is so nice, you read bedtime stories, these things will help. In addition to that, night lights. If they're a bit scared of the dark, you probably have that already, but you can add night lights. Let them know get baby monitors in the room. Mommy, daddy can hear you. If anything happens, we can run in quickly, we're always there. And those type of reinforcement in addition to what they shared. Again, transition is a major thing. Like, for example, when kids are going to daycare. The kids go to daycare the first day and they cry because sometimes the parents didn't think on to take the child the day before or a week before. This is going to be a new teacher. This is going to be a new classroom. This is going to be a new place of play, and you transition them. You let their mind start thinking. This is a safe space. This is a comfortable place. It's the same thing. And so when you take that child the first day, if the child is still crying, this is a safe place, but they're accustomed. They've met the students, met the teachers, been in the environment. The same thing you can do at home. We transition from section to section. And again, like Doctor said, sometimes, again, although there might be 6 developmental stages, might not be at the same as a regular 6-year-old. So those are things we take into account as well.
Thank you, panel. Ladies and gentlemen, please give a round of applause for this amazing panel. We thank you very much, Dr. Mike, Dr. Turner. Oh my gosh, the doctors are in the house. Apostle Foy and Dr. Josephine. We're going to move into a segment now where these lovely people will be around for a few minutes or so, right? Or maybe the rest of the morning, so they can meet with you and ask questions if needed. The next segment we're going to do is our breakout session. And within these segments, you just have to take a moment, look at the agenda. There are 3 options. You have 45 minutes, you choose a group. The first one is around play therapy and supporting ASD, or Autism Spectrum Disorder, and learning development. That's is going to be led by Dr. Josephine Claxton-Richardson, and we also have Ms. Rosemary Monroe and Dr. Grenion. The 3 of them will be in the room behind you. They'll just follow the light that goes towards the bathroom. There's a room behind there. It's a very fun, hands-on experience. I've experienced it yesterday at Cedar. I'd encourage you, if you'd like to learn a bit more about play therapy, you join that group. The next one is Seeing Through a Different Lens, Understanding Dyslexia. That's with Tilly Bruce, our special education teacher over there. Kate Mallon, another specialist over there, no stranger to our space. And we have a new face, I'm going to say this wrong, Tricia, John Prescott, another amazing teacher with us, and they will talk about how you support dyslexia in the classroom and how it transitions to home. And then we have an ADHD and me group with Dr. Rylene. Is Dr. Rylene here? Yes? Dr. Rylene, there she is. Crystal Estridge and Latoya Brown, who, by the way, guys, forgive me for not saying, we have a spa here with us today, okay? And back there, some people notice and they're already getting their mini massages. But they're with us until lunchtime, so when you get a moment to sneak over there and get a little rub, you know, just kind of loosen things up a bit. But we're going to talk a bit about well-being this afternoon and why it's important to take some time out. So let's transition. Just our group leaders are going to wave at you, so you just make your way to where they are. And so again, ADHD and me, is that you back there, Charlotte? Yeah? On the bleachers, that's where the ADHD segment is going to be. So just shuffle around to where you want to be and engage with your group. Foster, founder of the Lemonade BVI group. Lemonade started out as a parent support group where it's just a few of us in the library having tea and biscuits, talking about why it's important to have support and community when we have children with special needs. And so we built on that, and it grew and it became a movement, a network of parents, teachers, doctors, therapists, amazing philanthropists like Brittany, who just step up and say, look, we're going to do something for these kids. We're going to do something for parents like me, and just make the journey a little bit easier. And so when I met with Brittany and Ashley, and they told me about this amazing idea about benefits of using horses and how equine therapy can help us parents as well as children regulate, I thought, well, yeah, you're doing this. So Ashley will tell us a bit about that.
Now, horses have the innate ability to help us regulate. They are wired in their system to pick up on changes of energy in their environment. So as they learn our energies, they'll adapt to us. It teaches us a sense of calm. It teaches us a sense of presence. With these children and with anybody really, just being around them helps regulate our heartbeat. Horses' hearts beat slower than ours. They're larger. They don't have to pump as quick as ours. And just being around them and having that sense of awe of their power really helps. With any adult or child that has special needs, you can also work in therapy, which works with their physical therapists and occupational therapists, increasing balance, range of motion. You can do equine assisted learning and development, so you work with speech therapists and work on simple words and motions. And also self-confidence. You can set up simple obstacles and have them achieve something that they feel so much greater than themselves. And with those little small steps, it really turns into something that is big and amazing.
And it's just so beautiful to see. So our slogan down here is one person's opinion of you does not have to become your future. And these horses are all rescues themselves. This is an initiative under our nonprofit, Aerial Recovery. And they are rescues. They learn to trust again. They are put through their own healing program. And once they are healed, they are then used to help heal and progress others. And utilize them for our veterans. We are now using them for the children with special needs in Lemonade on Tortola. And we love the partnership because it's just full circle. One person said that these horses, these zebras were worthless, nobody would ever want them, and threw them away. And when they're here, people see how beautiful, cherished, wanted, and needed they are. And so we are so grateful to be able to share that gift with other people who get to experience this ranch.
Absolutely, and honestly, we see that a lot with our kids in the community, kids with special needs. Parents are hiding them away, they're not taking them to school, they're not taking them out into social situations. Like these horses, they may also be considered outcasts, but they're not. They're beautiful, they're amazing, they've got lots to offer, and we're making those opportunities available to them. So anytime you're ready, just reach out to Lemonade, reach out to Brittany and her team. We're ready to take you with us on this journey.
Imagine trying to grab water with your bare hands. No matter how tightly you clench, it slips through your fingers, leaving you with just a damp, frustrated grip. That's often what living with ADHD can feel like. It's not a lack of effort, not a flaw in character, and certainly not something you can just try harder to overcome. It's a neurological reality, a different way the brain is wired, and it impacts everything from focus to emotional regulation. For years, ADHD was dismissed as a problem with hyperactive kids who couldn't sit still, but that's a dangerously narrow view. The truth is, ADHD is complex, multifaceted, and manifests in countless ways. It's a spectrum, and understanding its symptoms is the first step toward managing it, embracing its unique aspects, and ultimately, thriving with it. In this video, we're diving deep, pulling back the curtain on every major ADHD symptom, explaining what they truly mean and why they matter. So, if you've ever felt like your brain is running a marathon while your body is stuck in quicksand, or that your internal world is a whirlwind of brilliant ideas and frustrating missteps, then this is for you. Let's unpack the reality of ADHD, one symptom at a time. Symptom 1, the elusive nature of focus. Inattention. When people think of ADHD, inattention is often the first thing that comes to mind. But it's not simply not paying attention. It's more like your brain has 1,000 open tabs, and they're all vying for your attention simultaneously. Imagine trying to read a book while a dozen other conversations are happening around you. A TV is blaring, and a dozen thoughts about what you need to do later are screaming for acknowledgement. It's not that you can't focus, it's that your focus is constantly being pulled in different directions. This can look like difficulty sustaining attention on tasks, even those you find interesting, making careless mistakes, not listening when spoken to directly, failing to follow through on instructions, or easily getting sidetracked. It's the constant battle against a wandering mind, the internal tug of war between what you should be doing and what your brain wants to do. The world is too interesting, and every stimulus becomes an invitation for exploration. Symptom 2, the restless spirit, hyperactivity. While not every person with ADHD experiences significant hyperactivity, it's a hallmark symptom, especially in childhood. But it's not always about bouncing off the walls. For adults, hyperactivity often internalizes. It can manifest as an inner restlessness, a feeling of being driven by a motor, even when you're sitting still. It might be fidgeting, tapping, pacing, or an overwhelming urge to always be doing something. It's the constant need for movement, even subtle. This can make quiet activities difficult, lead to excessive talking, or a general feeling of being unable to truly relax. It's the physical manifestation of an overactive brain, the body mirroring the mind's unceasing hum. This isn't a choice. It's an intrinsic drive that demands an outlet. Symptom 3, the impulse control challenge, impulsivity. This symptom can be incredibly challenging and often misunderstood. Impulsivity means acting without thinking through the consequences. This isn't recklessness for the thrill of it. It's a breakdown in the brain's stop mechanism. It can lead to blurting out answers, interrupting conversations, making hasty decisions, overspending, or engaging in risky behaviors without proper foresight. It's the inability to hit the brakes before the thought becomes an action. This can strain relationships, create financial difficulties, and lead to regret. The pause button in the brain, which allows for reflection and consideration, often feels broken. The immediate urge takes precedence, and the future consequences only become clear in hindsight. Symptom 4, the time warp, time blindness. This is one of the most frustrating and often overlooked symptoms. Time blindness isn't just being bad at managing time. It's a fundamental difficulty in perceiving and estimating its passage. For someone with ADHD, time isn't a linear progression. It's more like a series of nows. The past is a vague memory, and the future is an abstract concept that feels perpetually far away until it's suddenly upon you. This leads to chronic lateness, underestimating how long tasks will take, difficulty planning, and missing deadlines. A deadline that feels weeks away can suddenly be tomorrow, and the urgency only kicks in when it's too late. It's like living in a perpetual present, where the clock is always playing tricks on your perception. Symptom 5, the emotional roller coaster, emotional dysregulation. While not officially part of the diagnostic criteria in some manuals, emotional dysregulation is a profoundly impactful symptom for many with ADHD. This means experiencing emotions intensely and having difficulty regulating their expression. Small frustrations can escalate into explosive anger. Minor setbacks can trigger deep sadness, and joy can be overwhelming. It's not that emotions are wrong. It's that the internal thermostat for emotional responses is skewed. This can lead to frequent mood swings, irritability, low frustration tolerance, and an inability to bounce back from emotional upsets quickly. It's like living with an exposed nerve ending, where every emotional experience is amplified, and the ability to self-soothe is compromised. The world feels more intense, and your reactions often mirror that intensity. Symptom 6, the struggle to start, task initiation, difficulty. This isn't about laziness. It's about the brain's ability to kickstart action. Task initiation difficulty means knowing what you need to do, wanting to do it, but feeling an invisible wall between your intention and action. It's like standing at the edge of a swimming pool, desperate to get in, but unable to take the first step. This can manifest as procrastination, leaving tasks unfinished, or feeling paralyzed by overwhelming to-do lists. The friction required to begin a task even a simple one, can feel insurmountable. This often leads to feelings of guilt and shame, as others may perceive it as a lack of motivation, when in reality, it's a neurological hurdle. The path from thought to action is cluttered with invisible obstacles. Symptom 7, the memory maze. Working memory deficits. Working memory is like your brain's temporary notepad, where you hold information to manipulate it. For those with ADHD, this notepad often feels incredibly small or leaky. This means difficulty remembering instructions, forgetting what you were just doing, losing track of conversations, or struggling to follow multi-step directions. It's why you might walk into a room and forget why you entered, or constantly misplace your keys and phone. It's not a problem with long-term memory. It's the short-term, active memory that struggles to retain information in the moment. This can make everyday tasks feel like a constant scavenger hunt for information. Symptom 8, the hyperfocus paradox, when focus becomes a trap. This symptom is the fascinating, often misunderstood counterpoint to inattention. Hyperfocus is the ability to intensely concentrate on something that does capture your interest, to the exclusion of everything else. It can be a superpower when directed toward productive tasks, leading to incredible bursts of creativity and productivity. However, it can also be a significant challenge. You might lose track of time, forget to eat, neglect responsibilities, or become completely absorbed in an activity while the rest of the world fades away. It's like a laser beam of attention, incredibly powerful but difficult to redirect once engaged. The world outside the hyperfocus task simply ceases to exist, making transitions incredibly difficult. Symptom 9, the organizational overload, disorganization. This is more than just a messy desk. Disorganization in ADHD stems from difficulties with executive functions like planning, prioritizing, and managing information. It can manifest as cluttered living spaces, chaotic work environments, missed appointments, and a general struggle to maintain order. It's not a lack of desire for organization. It's a struggle with the process of organizing and maintaining it, keeping track of belongings, managing paperwork, or creating effective systems can feel like trying to build a sandcastle in a hurricane. The sheer volume of information and tasks can be overwhelming, leading to a constant state of mild chaos. Symptom 10, the rejection sensitivity, RSD. Rejection sensitive dysphoria, RSD, is an intense emotional pain in response to perceived or actual criticism, rejection, or teasing. While not a standalone diagnosis, it's a common and profoundly painful experience for many with ADHD. The emotional response is disproportionate to the event, leading to feelings of shame, intense sadness, or anger. It's like having an emotional sunburn, where even a gentle touch feels excruciating. This can lead to people-pleasing behaviors, avoiding social situations, or withdrawing from relationships to protect themselves from perceived hurt. The fear of being judged or criticized can be debilitating, creating a constant state of hypervigilance in social interactions. Symptom 11, the energy fluctuations, dysregulation of energy levels. People with ADHD often experience significant and unpredictable shifts in their energy levels. One moment they might feel wired and restless, buzzing with an almost frantic energy. The next, they can feel completely drained, exhausted, and lethargic, struggling to even move. This isn't just normal tiredness. It's an extreme and rapid fluctuation that can be incredibly disruptive. It's like your internal battery goes from 100% to 5% in minutes, without any clear reason. This can make consistent performance challenging and contributes to the feeling of being on or off rather than having a steady, predictable energy supply. Managing daily life becomes a constant negotiation with these unpredictable surges and crashes. Symptom 12, the overwhelm epidemic, sensory overload and brain fog. Finally, many with ADHD experience heightened sensitivity to sensory input, leading to sensory overload. Bright lights, loud noises, strong smells, or even certain textures can feel intensely irritating and overwhelming. This can lead to meltdowns, withdrawal, or a desperate need for quiet and calm. Coupled with this is brain fog, a feeling of mental cloudiness, difficulty thinking clearly, or a general sense of sluggishness in cognitive processes. It's like trying to navigate a dense fog, where clarity is elusive, and every mental task feels like pushing through treacle. These two symptoms combined can make navigating the world incredibly draining and contribute to feelings of exhaustion and frustration. Understanding these symptoms isn't about finding excuses. It's about finding explanation. It's about recognizing that a differently wired brain operates differently, and that these differences come with both challenges and unique strengths. Embracing this understanding is the first step toward building strategies, seeking support, and ultimately, living a life that truly aligns with your unique neurological makeup. For a deeper dive into practical strategies and a compassionate understanding of how ADHD truly affects your life, I highly recommend Your Brain's Not Broken by Dr. Tamara Rosier. It's an incredibly insightful book that helps you understand the emotional landscape, time perception, and motivational challenges unique to ADHD, offering practical ways to improve your symptoms. You can find a link to purchase it in the description below. If this deep dive into ADHD symptoms resonated with you, if you found yourself nodding along or understanding yourself a little better, please like this video to help more people find this information. And for more insights into the complexities of the human mind, subscribe to the channel. Also, I'm curious, which of these symptoms do you find most challenging in your daily life? Or which one was the biggest surprise to learn about today? Share your thoughts in the comments below. Your experiences are invaluable. And if you're interested in understanding more about complex psychological profiles, you might find my last video, 10 Signs You Are Dealing with a Psychopath, Not Just a Narcissist. Incredibly insightful. Thanks for watching, and remember, understanding is the first step toward empowerment.
If you're dyslexic, it's kind of your superpower. It's like the way that you think.
Our brains, they're wired to, I think, process information differently.
It's just the way that you see the world.
I don't think people do think the way I think.
The way I see the world might be different from somebody else, but that's valid. In fact, it's vital.
Dyslexics literally think differently. We have a different wiring of the brain, which means that we're really good at certain things, but we have real challenges at more traditional education and learning.
The dyslexic brain actually processes information differently. So while it manifests itself in reading, writing, and spelling, and that's where it's most obvious, it's really a difference in how information comes into the brain and is processed, which can create difficulties, certainly in an academic setting, but also amazing opportunities and abilities.
Their minds work in very diverse ways. They're able to see the world in a way that we are not.
So dyslexia is very common. We now know it's about 1 out of 5 students are dyslexic. So if you're a teacher, you've had a dyslexic student in your class.
The strengths they have are incredible. The way they can think around things, the ability to see the big picture.
They are problem solvers. They are outside the box thinkers.
Creative in the way that they can come up with solutions and ideas, but also in the way that they can invent new things.
They are curious learners who are eager to explore.
They have had to develop other alternative paths. So those elements of them often become then practiced, rehearsed, and better functioning.
They tend to be innovators, they tend to be entrepreneurs.
They're spirited, they're often really good with people.
A lot of dyslexic learners tend to be daydreamers, but while they're sitting there, they're not paying attention or being disrespectful. Oftentimes they're really coming up with innovative solutions.
Dyslexia is neurological. You could look at a dyslexic brain and you would see that it was behaving in a different way.
The average thinker may get from A to B very quickly. It's like they're on a highway. But what I tell my students is that the dyslexic brain is more like you're taking the scenic route. And it may take them longer to get from A to B, but think of all the things they're going to see.
We now know that dyslexia is definitely genetic. And if a parent struggled with reading, if a parent had a difficult time in school, there's at least a 50% chance that their child is going to struggle as well. We also know that if a parent struggled and then a sibling is diagnosed with dyslexia, the brother or sister has more than a 75% chance.
So it is very important for parents to be aware, especially be looking for those signs early on with your child.
We can start identifying a child as being dyslexic really as early as 4 to 5 years old.
I would be looking for a direct mismatch between what a student is capable of and what they know versus the output of learning.
Students who are falling behind peers in letter recognition and matching sounds to letters, or might be inconsistent in it.
Big red flags for us for what we look for are the inability to name common objects quickly, to memorize things that seem everyday and easy, days of the week, months of the year, putting the months of the year in order.
Anything that requires retrieval, anything that requires remembering something instantly and bringing it back.
It can affect how you work with numbers. It really affects how you sequence things.
The earlier we can identify a child as dyslexic, and also the earlier we can help a child understand their strengths and weaknesses, the more of a profound impact that we can have.
We need to be screening all students early and frequently. A dyslexic child should know they're dyslexic, and they should know what dyslexia is, and that is almost the most powerful thing that we can give them.
It's empowering, that label's empowering because it stops being about you, it becomes about a different way of doing something.
The parents knowing that a student is dyslexic really gives them the pathway to start walking down, that there's a direction that they can go in now. And for the teacher, it helps to know that there's a reason why they're not memorizing their spelling words, or there's a reason why they can't read.
For decades, really 50, 60 years, we've had a fairly solid understanding of what we need to do. What a dyslexic learner needs at the end of the day is a strong phonics instruction that's grounded in a multisensory approach. And by multisensory, what we mean is that we want to engage all the different senses or the way in which the brain learns and processes information.
Anything you need to do to support a dyslexic child is great teaching practice for all children.
No one suffers when we build classrooms to support dyslexic learners. In fact, everyone is only made better because of it.
Teachers, parents, employers, really the world needs to be more aware of the definition of dyslexia.
To understand that a child is dyslexic is not rocket science. There are steps that we can take, there are screeners that we can begin to use, there are things that we can look for in order to recognize that this child thinks differently, and that we need to provide them the support and the approach to education that resonates and makes sense to them.
We want to be able to democratise this support and help teachers all around the world to be able to understand what dyslexia is, to understand the huge value of dyslexic thinking and the real importance of identifying it and supporting it early.
Imagine a world where you've got, where you've got like a force of people who have this gift of dyslexia educated in a way that supports them. It means anything's possible, It means anything is possible.
It's like a superpower in a way, because you can see things that other people can't. You see the bigger picture.
I'm better at hockey because I know where to stand in the pitch because I can understand the game better. I really like making my own stories.
I love storytelling and I love communication.
I was always very good at creative writing.
I always make my own songs up in my head.
Actually, I'm a rapper, so then I express myself while rapping.
I would quite like to be a pop star.
I'm so lucky because I always knew I wanted to be an actor and I get to do this for a living.
As a child, I dreamt of being a scientist.
One of my strengths is maths. I like building little robots and lots of different things. Just remember that you're different and it's a good thing.
We talk a lot about how a dyslexic learner is not made for the traditional classroom, they're made for the world. And it's because they see things differently.
Working with dyslexic children, you see that their minds work in very diverse ways. They're able to see the world in a way that we are not.
The strengths they have are incredible. The way they can think around things, the ability to see the big picture.
They are problem solvers, they are outside the box thinkers. Because they process information differently, they're able to see things from different angles.
Many dyslexics are also very good at visualizing the big picture, thinking through multiple steps and seeing connections, almost a symphony of ideas that they can bring together.
Dyslexics are exceptionally curious learners. They're eager to explore. If you tell a dyslexic that something is done in one way they will find 3, 4, 5 other ways to demonstrate that exact same skill.
Some of the greatest innovations, some of the greatest breakthroughs in our history have come out of a dyslexic mind's refusal to just accept the status quo.
They ask why constantly, which is fun in the classroom. They don't just take information for what it is. They want to know why. They want to know the background. They want reason for it.
Dyslexics tend to be very creative and very good at imagining new ideas. They tend to be innovators. They tend to be entrepreneurs, the game changers in our world, or that disrupt industries, that provide solutions that we didn't even know that we needed, or to solve problems we didn't even know we had.
I may give certain instructions and am expecting a certain outcome, but with my dyslexic kids, I can never predict what they're going to come up with, and it's always, outshines my expectations.
Some dyslexic learners can actually think three-dimensionally. They can move parts around in their heads so that they can understand how in physical space things are connected. This is going to be the child who is very good at Legos, that can put things together. It might be the child that takes paper clips and folded pieces of paper and an eraser and suddenly makes an entire city out of it. It might also be the child who, when you put them on the stage, they suddenly come to life and they have this physical presence where they can move their body in a way that really expresses something. They also could be the child that on the sports field seems to have this premonition of how things are going to work. The child that can predict where the ball is going to go, or know to move left when everyone else moves right, because they understand that that's how the play is going to come about.
They're able to understand themselves in a way that, of course, helps them in the classroom and outside the classroom, but they're also empathetic and understanding towards others. They're able to make connections with others, so they're wonderful friends, they're compassionate, and they're just really excited to be around others.
They tend to have wonderful relationships and be able to take ideas and communicate things in ways that really resonate with other people. So despite the fact that they might have a difficult time with the written word, and despite the fact they might have a difficult time trying to take their ideas and putting on paper, dyslexics tend to be very, very verbal individuals, and they tend to be very comfortable in that space. That's where they tend to thrive. So at the same time, these are kids that go on to be politicians and great orators and actors, amazing and accomplished writers and authors. Throughout history and even today, some of the most popular writers in the world are dyslexic. And that's because they have an amazing command of our language. They have amazing command of words.
In the classroom, dyslexic students really need an opportunity to shine with their imagination and their creativity. If you want them to be inside the box, they're not going to be.
So many of our dyslexic students are incredibly imaginative. They are daydreamers, but of course with dyslexics they're thinking of so many different things in their mind and coming up with so many creative ideas.
I see a child who's looking out of the window because they're thinking about what you've said, they're processing it, and they're going to give you an incredible answer in a minute when they've worked out how they're going to say it. They're thinking about what you've said and probably linking it to something you haven't even thought of.
It's something that we need to help them understand. When is it appropriate? How do we work with them to cultivate that so that we don't diminish that truly amazing capability while also making sure that they do meet the expectations of the classroom.
If you're giving an assignment, I think you need to think of those creative brains and how can they best show what they know.
They like to think. We need to give them time to do that. Dyslexic people like to think. They like to think about what you've asked them and they need time to give you the answer. But they're often thinking because they're good thinkers and they're going to give you something amazing in their response.
Don't just limit it to multiple choice answers or a quiz or a test on paper. How can you as an educator get out the information from them in the way that best suits their brain?
People talk about computers being the fourth industrial revolution. They can do all the linear thinking. They can do the things that are the barriers. A computer can't think laterally around a problem. A computer can only generate the data it's being given.
And you need that neurodiversity, you need that dyslexic brain to be able to see that bigger picture.
Without question, dyslexics bring amazing opportunities to the workforce. And when really we think about the 21st century and what it holds and the demands on the jobs of tomorrow, dyslexics are going to thrive and bring so much to that.
We recently produced a report with EY that looked at how important dyslexic thinking skills are for the future. They actually looked at the research that the World Economic Forum had done around how skills are changing and artificial intelligence is completely transforming the skills map that employers are looking for. They then took those skills and mapped them directly across dyslexic thinking skills, and there's a complete match. So we know how hugely important it is that educators right now are looking for those skills and enabling and nurturing them.
I think it's vital that teachers are trained about dyslexics because the world is changing and imagination is key to everything, and there's going to be a lot of kids whose potential are lost unless we train our teachers to effectively teach them.
I love children on the autism spectrum because they teach you a different way how to love. They teach you the meaning of acceptance, the meaning of patience, and I just think that generally they're awesome individuals.
Each and every individual is different, so you cannot, like, say, put them under one umbrella to characterize them. You cannot say, how come this one is this way, but that one is that way,
It's a spectrum of the autism, one side of autism, so that they have their own world, so we have to help them to develop, to be part of the society.
They get you to look at things in a different way that you might have not before. You get to learn empathy, you get to learn perspective taking, you get to learn the value of things that you never valued before. So I love being in this profession because it helps you to become more open-minded and accepting and loving towards everybody.
I'm just literally like so grateful, like.
This is amazing, first of all, and encouraging to see so many parents, mental health professionals, teachers, administrators be here on this inaugural and this.
Because I realized there was a need in the BVI, and I came back home so I can be an asset to my community.
What it's like to be an adult with ADHD, and so you'll hear firsthand how difficult it is.
I myself have ADHD. I've been diagnosed for a long time.
He asked me to get him tested for ADHD.
Don't leave interventions too late. Every school year your child is untreated, they'll be falling further behind their peers.
The inattentive type, the type we used to call ADD. It's best to always start with the behavior strategies.
The first one is be patient. Don't compare your child to anyone else's. My last and most important point. Your child will get there.
Because over half the children who leave school unable to read or write are dyslexic.
they're more likely to be disadvantaged. People with dyslexia have shaped the world. The light bulb, the smartphone, flight, they all sprang from the wonders of dyslexic
I was able to
thinking.
get some tools and support, and I got formally diagnosed when I was 37. I think one of the most eye-opening moments was when someone said, "Have you tried overlays?" I put a yellow overlay over my writing and black writing on white paper, and everything stood still. I was like,
I must have been beaten with a stick without any trousers. It wasn't much fun in those days, and the school system was horrendous, you know.
We have different areas within education that caters to neurodiverse students from grades K all the way up to grade 12. We do have intervention services as well as individualized plans for our students, and they go from kindergarten all the way up to 12th grade.
Some teachers don't understand that people are dyslexic. They just
specialist, and he will speak with us a bit about supporting children in the classroom. So as we come to our seats, we're just coming out of the break, Chester, so as we get settled, we will begin. If you'd like to get started, I think, yeah?
Should I start? Yes?
Yes, please do. So without further ado, let's welcome Chester Lakatu.
Hello, good morning from Trinidad and Tobago. I'm extremely excited to present this segment on dyslexia at your conference in the British Virgin Islands. My name is Chester. I like to go by first name. So Chester, well, Chester Lakatu, but Chester. And my present status is that I am currently reading for my doctoral degree from UNICAF University and the University of Zambia. My thesis being, and this is very important, especially in my country, the relationship between disruptive behavior and dyslexia at-risk secondary high schools in Trinidad and Tobago. Welcome everyone, and especially parents and teachers, because this segment is geared towards you in assisting these children within the classroom setting and assisting them at home. Now, we're going to start off. What is really dyslexia? Dyslexia falls under the broad category of learning disabilities. It's called learning disabilities in the United States, in North America, United States and Canada, and then I believe in England it's called learning difficulties. Dyslexia can be divided into two, visual and auditory dyslexia. We will be speaking more on the diagnostics or the screening of visual dyslexia in this segment, because from my work with these children, there are a lot of these children within the school system, okay? So it's a neurological dysfunction disorder. What do we mean by that? Now, it is very important to learn exactly the general characteristics of a dyslexic child. First of all, a dyslexic child is not below average intelligence. They are above average intelligent children. In the classroom, sometimes what I've known is that teachers would refer to these children as slow learners. Again, that is incorrect. These children are not slow learners. They can pass a test orally, and if they can do this, then they should not be considered slow learners. They are not below average intelligence. There are certain general characteristics that we look for when we are screening these children, and this is very important. From the beginning for literacy development, you would find that they are not picking up, identifying the letters of the alphabet and learning the sound. They have difficulty in doing this, whether it's identifying the letter or knowing its accompanying sound, okay? So this is the first part, and this is very important in literacy development, as we know, general overall literacy development. Sometimes these children would sort of trick, we shouldn't use the word fool, but trick teachers and parents into knowing that the parents or teachers would think that these children could read because they're reading the books they are assigned to, but they are not really reading the proper way. They are learning to read by rote. They use their auditory senses and they just listen to what is being said and they remember it. So you can open the book and they will read that entire book for you and you will think that they're reading. But if you pick out certain words and you put it on a piece of paper, they will not be able to read those words. So this is important to know. So they will learn that they would learn to be read by rote. Little things, general characteristics. Other characteristics that the general characteristics that a dyslexic child might have, these are what you call general characteristics. It's not specific direct characteristics. They will have problems with probably left and right, okay? Or they will have probably small minor motor disturbances for like cutting using their fingers and stuff like that to do certain things, building a puzzle. They will have problems like that. So these are some of the general characteristics. Okay, so as someone who deals with these children, assists these children with literacy development for a number of years, what are the areas that we look at? When a parent approaches and says to me, Chester, I know my child is intelligent. He or she does everything else. They know everything, but they are good socially, but only when it comes to literacy work, reading, writing, and spelling, that they would have problems. What is wrong? And from that time, you would believe that something is wrong, that they are what you call, that it's a precursor to dyslexia or dyslexic tendencies. So what we can do, it is very important, what you can do with these children is that when you are screening them, you look at their work, look at their written work, so you can pick up the specific characteristics for screening these children. Okay, now these are the characteristics. You have 5 characteristics, and you have to look at it. If you look in their written work, you would see these characteristics, these particular characteristics. One, and everybody knows this, you hear about it all the time, mixing up of B and D. So it will be mixing up of B and D, yes, but it will be mixing up of B, D, P, Q as well. These are the letters they will mix up in reversal. So they will actually write these letters, okay, down. So if they see a P, they can write a Q. Vice versa, any of those letters they could mix up, right? That is what you call reversals. Then you have what you call inversion problems. They would mix up, some will mix up the M and the W, the T, the F, the U, and the N. That is what you call inversion problems. So we have reversals, we have inversions, we have what you call sequencing problems with the child's handwriting. So the sequencing problems now will be like, this is just an example. A child will write G-I-R-L for girl. G-R-I-L for girl, G-I-R-L. So they would have all the letters in the words, but it will be mixed up, sequencing problems. Okay, that's called sequencing problems. Then you have what you call configuration or shape problems. For example, the H and the N, that little piece, they make mistakes with that. They mix up the H and the N in their written work. And finally, you have what is called internal detail, where certain letters that have detail internally, like the E, they will mix it up for the O. So if you look at a visual dyslexic work, you would see any of these mistakes happening in their work. And this is how you do the screening for these children, okay? Now, dyslexia is like this. It's not brain damage, it's a brain dysfunction, okay? What you say, it's a brain dysfunction. In layperson's terms, this is what is happening. If I am dyslexic and I'm looking and I'm reading or I'm trying to differentiate letters, when I see the M and it goes to my brain is telling me it's a W. Simple. It's simple like that. So these are the things you look for with the visual dyslexic traits. So you will have problems with literacy, overall general literacy, because if you don't understand letters, you will be able to put the sounds together, process the sounds together, and the child would have problems. Now, another fallacy is that a lot of these children who are dyslexic, teachers would always say, well, your son seems to have, or your daughter seems to have an ADD problem, attention deficit, or an ADHD problem, attention deficit or hyperactivity, whatever you want to call it. And in reality, this is not so, because if a child is in a school environment and they are not understanding what is going on with the academics, in the curriculum, or whatever you're teaching, what would they do? They would look around, they would not pay attention, they would daydream, because they are not understanding what is going on in the class. So in reality, they don't have an ADD problem. They don't have an attention problem. Also, what happens with some children is they develop a behavioral problem, okay? Again, because they are not understanding what is going on in the classroom setting, they might be a little mischievous, look for something else to do. And this is what they would have. Eventually, some children would develop disruptive behavior in the classroom setting. So you have to look at all of that when you're looking at these children. Now, I'll be very honest with you with certain things. I hope I don't step on anyone's shoes. When children have literacy problems, or when they have dyslexia, they most of the times in the schools, they want them to go to an educational psychologist to be diagnosed. Okay, now that's all well and done, but they are referred to the diagnostic specialist, the educational diagnostic specialist, as a child with literacy problems. Now we know these children have literacy problems, so the educational psychologist will run all the tests for decoding, for phonological processing, all these extra tests and stuff like that. And they would come out, their results will be, yes, the child will be lower in this area, but we know that already. What we need to know is if the child, why does the child have a literacy problem? We need to know if this child is dyslexic. We need to know because we need to do the remedial work to help and assist these children in the classroom, whether the child is visual dyslexic, whether the child is auditory dyslexic, what range, is it mild, medium, severe. So if the child is going to a specialist, an educational psychologist, the report should, at the end, although they're going for general literacy development, because they're deficient in that, must have what this child is, because when the report goes back to the school, we have to know how to work with these children, right? So that is very important. So we have screened for dyslexia, and I do not know the population in the British Virgin Islands, but there are hundreds of students within the school system in Trinidad and Tobago that have this problem. And listen, if the problem is not caught in the primary school, it gets worse when you have to go to the secondary school. And this is a major problem with our schools in Trinidad and Tobago. So let's look at some remedial strategies to help to assist these children within the classroom setting. First of all, we have to know that if the child is having problems from small and they don't know the letters and the sound, the phonics approach, it doesn't help, okay? You have to use a different approach to assist these children with the building of the identification of the letters and the sounds and knowing the sounds. You know, a lot of times you say, well, get the jolly phonics, get this phonics for the child and work with the child. It doesn't help. Okay, there's a program, and I'm sure that you all heard about this program before. And it is a major program that assists these children. It's called the Orton-Gillingham approach to teaching dyslexic children. And the fun thing about it is this approach could be used with not only dyslexic children, but other children who may have literacy problems, but who are not even dyslexic, because truthfully, if you're having literacy problems, it doesn't mean that it's dyslexia. It could be other factors involved. But the major, one of the major factors for literacy problems is dyslexia. So teachers, and this is the first year and second year teachers, when you have to work with these children, I'll just give you an example how it is different in helping these children. So we're teaching the letters and the sound. We're not going to do the vowels at first because the vowels have long and short sounds, okay? And everything, the dyslexic child gets mixed up really fast. So we're going to take two letters and put it in common letters on a piece of paper, right? On a piece of paper. And we're going to work with these children. We're working with two letters. Two letters we're going to start off with. We don't choose letters that look alike or have the same shape, or we don't choose letters that have the same sound, that sound alike. So we will start with F and V, or F, or we will choose P and B because they look alike and they sound alike. So let's use R and S. So you're going to show this child a letter, and you're going to say, John, let's say the child's name is John. John, this is the letter. These are two letters of the alphabet. You're going to put down one, and let's start with the R. This letter is a letter of the alphabet. This letter sounds R, R, R. And you will ask John to say the sound. And John will say, hopefully will repeat the sound. And then you would ask him to say, give me some words that begin with that sound. R, R. And then after John gets the sound, you do the other letter, the S, the same approach, and afterwards as you put it up and he tells you the sound, then at the end you give the name of the letter. Okay, John, this letter sounds S. This is the letter S, and that is basically an approach. Sometimes a dyslexic child is so severe, you will tell him the sound, and they would not, they would not be able to look at the letter and say the sound. What you have to do now is to let them trace it with their finger, work with traction and kinesthesis, and say S, 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 until they get it, and it eventually works. Now, this takes a lot of time. We know it takes a lot of time, and from then on, you move up in a hierarchy. When they get the sounds in, you take some of the vowels, but you only do short sounds first. You don't want to, again, confuse the child. You don't say, well, there's a long sound and a short sound. These children get confused really well. You don't use word sound associations. You don't say pan. Okay, they get confused. You don't use word sound association. So this is the Orton-Gillingham approach. And then you move on from there. You move on from there and you move up to word families. You teach sight words. And then you move on to the reading segment and you build up on that. So this is basically what the basis of the Orton-Gillingham approach, and it's a whole system. You could get certified in it and to teach dyslexic children. Now, I want to tell you something as well, that teaching these children, it's a special type of teaching. It's not extra lessons. Sometimes parents send students extra lessons thinking, well, it's not extra lesson. You have to know what you're doing. So it's sort of a clinical, remedial treatment, okay? Because what you're doing is that you are retraining that child's brain actually, right? And and a lot of people, when you go to lectures, they don't tell you that. You actually have to be doing that. So as a dyslexia specialist or somebody who's doing remedial treatment, you have to know that when you're helping them with literacy, you're actually retraining their brain. So for example, in my teaching, this is what I do. Before I give a child to read something, I ask them to write it from a sample, right? And when they write it, I would look at it, and if there's a mistake, dyslexic mistake, I will say, look over your work, there are two mistakes in line 1 or line 2, and correct it first before we start to read it. when they look over their work and they compare it with the sample and they fix it, only when they figure it out, well, this is not, look, I wrote an M, but it's not an M, it's a W, and they fix it, only then that they would be able to, they actually discriminate in it, and with time and work, the brain will actually, when they see a B, they will see a B, when they see a W, they will see a W. So it's over, you actually, it's a clinical work, you actually retraining that child's brain, that person's brain, so that they will discriminate sounds better and stuff like that. So that is very important. That is what must be a part. My advocacy is for, with dyslexia, is for massive training of teachers within the classroom setting, but teachers at primary school system. That is the only way you're going to get that help. Now, with my thesis now, we have to do different theoretical frameworks to support the thesis. And one of the theoretical framework that I've chosen is a response to RIT, response to intervention, where you don't depend on a specific diagnosis, but you work with the child, you look at the child and see if they're dyslexic from careful observation. Everything that I've said so far, if you're seeing that within the student, from careful observation, you start early intervention with them and you work with them as early as possible. As I said, unfortunately in Trinidad and Tobago, yes, special education is at the forefront, but still there are hundreds of students within the primary school setting, and teachers don't know how to deal with them, how to assist them within the classroom system, in the classroom setting, and they fall through the cracks. And the worst part about it is that when they leave primary school, there are schools, there are high schools where they place children who make 40% and below, who have a lot of literacy problems. In these schools, what you call at-risk schools, because you will have a lot of violence within these schools at that point when they reach there, a lot of disruption, a lot of violence. So teachers need to be trained. I don't know if in the British Virgin Islands, they're trained at the university level to be a primary school teacher. At the universities, there must be a module, a class, a semester class, where you will learn about learning disabilities, dyslexia, to assist these children in the classroom. These children are very, very bright. If you do your research, a lot of intellectuals in the past, famous intellectuals, are dyslexic, right? So these children should not be kept down and taught the correct way in the primary school system. Now, how could we help in the classroom setting? How could we help in the schools? I think each school should have a resource system where the principal could take 2 teachers who are versed in this and have these children every day be seen for at least half an hour outside in remedial work for dyslexia, and then place them back to the classroom. Again, in Trinidad and Tobago, this is not done. You have one section called the social support services, and it takes months and years to assist a child, and sometimes it's too late. It's too late. Now, as I said before, what I spoke to you was mainly on visual dyslexia, but there is another dyslexia called auditory dyslexia. And this is much more difficult to diagnose and to treat as well. It's totally different from visual dyslexia. And this is what I said before, if the child eventually goes to educational diagnosis, and if they have dyslexia, say if it's visual and or auditory. Unfortunately, I don't have the time to speak a lot on auditory, but there are children within the school system with auditory dyslexias as well. But as I said, from my past work, about 70 to 75%, or maybe more, 80, probably 80% of the children that have dyslexia are visual dyslexic. I think I'm out of time in a little bit, little while. I hope that teachers and parents have listened to this short lecture. I wish I could say more and do that, but the training is very important. And again, if there are any educational government officials listening to this, you need to train your teachers at the tertiary level before they get into primary school setting, because this is where we need to nip this in the bud so that these children will do well. Furthermore, your literacy rate will go up, the children do well, and just you will move on in life. So on behalf of Ms. Simone Foster for having me, and I hope my little lecture in layperson's term will help out the situation over there in the British Virgin Islands. And I look forward to further collaboration with any organization and Mrs. Foster's organization as well. Have a good day, and well, over to you, Mrs. Foster.
Thank you. Thank you so much. Let's give Chester a hand, please. Okay, so Chester actually has given up his time with us today because he's between sessions. So if you have any questions, I will ask you to leave it at the registration desk, and I will forward them on to Chester. Is that okay for you?
Yes,
yeah?
That's fine. That's fine.
And
that's
he
fine.
will answer you remotely.
Mrs. Foster, you could give them my email, okay?
Your email, okay.
And they could contact me.
Absolutely.
Okay?
Thank you so much for your time today. We really appreciate it. Thank you.
Okay, bye-bye.
All right. Okay, so that was our very brief and informative, hopefully, session with Chester Lakatu, a specialist in Trinidad on dyslexia. We'll move right along into our next panel before lunch. Promise for another exciting conversation. We have a slight change in programming, and we have two very familiar young ladies who will be joining me on stage, along with Dr. Connie George and Ty Jenica. So if you can make your way to the stage, Kate Mallon and Dr. Charlene Lewis, please welcome them. No, you won't. Anyway, yeah, just, hi, Connie. Okay, so we'll jump right into it. So this conversation we're having today with the lovely guests here on stage, we will be talking a bit about how we navigate challenges in our world. So it's around everyday solutions to support our neurodiverse families. So we have a mix of individuals here on stage. We have the professional, former chief education officer who's done amazing things, and also a board member at the Agape Total Life Academy. So we worked very closely in that recent project you may have seen in social media, where we were equipping that school with a sensory room and training for the teachers. Dr. Connie George was very instrumental in getting that through and across the line. We have with us Ty Jenica. You know, I mixed up her name. Is it Maduro George or George Maduro? Maduro George. She married a George. Okay. And Ty Jenica is like me. She's a mom raising a son with ADHD, and she has some very unique perspectives she'd like to share with us today. And we have Dr. Charlene Lewis, no stranger to this stage or this space. She also is a mom, but she's a mom of a son with autism. And she's also a medical doctor, so she has a dual perspective to share. And Kate Mallon, the lovely Kate, in her lemon dress. Listen, we have to get that lemon dress print. You have to tell us where you get it. So Kate is the school counselor at Cedar School, and she also lives with ADHD. Yeah, yeah. All right, so we will get the conversation going. Is there anything any of you would like to share before we get started? You have something you wrote?
Good morning, everyone. My name is Tyjenica Maduro George, a BVI lander. My son was diagnosed in 2018, so I have been, I guess, going through this from then to now. And I was recently diagnosed on the 18th of September for ADHD. It's a lot, but I have support. I was here last year, and I cry. I cry just hearing persons with their story, and I guess me going through the same, and that allowed me to, I was seeing everything mentioned about my son is me. He looked like me, he behaved like me, Papa would say, he is me. He is me. So I said I have to go and get tested so I could see how to move forward. Yeah, it have been challenging, but we're getting there. That's basically it.
Thank you. Thank you. Would you like to add anything, Dr. George?
Good morning, everybody. Not to add to her story, but you know, when I was asked to sit on this panel, I began to think, what am I really going to talk about? Because I don't have that kind of background. But you know, I saw Miss Dawson sitting there, and my mind went all the way back to when I was assistant principal at the Elmo Stout High School. At that time, we had a group of students that nobody could figure out what to do with them. And I, being the person that I am, I always have to find solutions. Something must give. There must be a solution to this. And so I remember at that time reaching out to Ms. Dawson and the then educational psychologist who was in the Ministry of Education. And I said, we need some assistance with something here. I don't know what it is. I don't know how it's going to work, but I know there must be something that has to happen. And I said, I'm calling because I believe we can begin with some kind of testing. Let's just see how this group of students, where they are, how they function, what's going on that we have not been able to tap into. And what I realized way back then, I don't want to tell you how many years because I myself don't even remember how many years, but way back then, what we are dealing with now and what we have defined so clearly was not as defined. And so you had students who would function, not function. You just made a way to put them into the next grade, but in fact not dealing with what was really the problem. So at that point when we did some testing, we had some incredible findings that led to Ms. Dawson taking a different route with those students. And eventually that group of students became our first group of special education students at the Elmo Stout High School. That's where that process started. It has since been very, very much defined and more working within a structure. But it started way back then, and I said to myself, now, if we had the knowledge that we have now, things would have gone so much different for that group of students and many others that came after. And so I look back and I said, I may not have directly, as a principal at the Elmo Stout High School, be able to say to you, we started a program, et cetera, but indeed we did. And that program has grown to what it is today. Again, as I moved from the Elmo South High School, went to the Ministry of Education, subsequently the Chief Education Officer, I walked right into what was, what should I say, a frying pan, where things just had to happen and things just had to change within the school system. Out of that came the very structured program that is there across the system right now. And I was very instrumental in really facilitating the persons who were, one, the lady at the ministry, I will remember her very fondly. She had quite a detailed program and had it sitting for quite some time. And I said to her, we're going to work this. She said, are you sure, Miss George? I said, yes, we're going to make something happen with this. And I've worked with her at that time, and I've continued to work over the time until we have what we now have, a therapeutic kindergarten at the Eunice Adams and all that kind of stuff. So I look back and I said, it is definitely very important that we defined and find where every child is at and be able to offer them the kind of assistance that they need. It's not impossible. And what we learned very quickly, the BVI was not the only place that need this kind of assistance. And children all can produce and function if we would find where they ought to be and where they are in terms of their academia.
Well said, well said. Thank you, Dr. George. And speaking of persons who may have experienced just that, Kate, in the past, you've shared with us that you've known you had ADHD from an early age and you've benefited from a system that supported you. Do you want to share a little bit about why it's important, especially as a school counselor, living with ADHD, how that support helped you, and then how does it shape the way in which you're able to assist other students now as a counselor?
Says hi to you. Nice.
It's a friendly mic.
It's a friendly mic. Hi, everybody. I'm Kate. So living with ADHD from an early age, a lot of positive reinforcement. A lot of kids with ADHD are kind of told they're doing things wrong. They're told no a lot. So it's catching those chances that you can where they're doing something right and putting the positive reinforcements and reward systems in place for them so that they can succeed. That's key. Getting the child, meeting them on their level and having that success is just instrumental for those children. And you can do this at home. You can do it with things like first thens in place because you give them a reward afterwards. First, you're going to brush your teeth. Then you can have your favorite story. And then they're kind of getting that reward and they're getting the success of brushing their teeth. Schedules. I always had a visual schedule. So the child can see what's going to happen next. These are just small little tools that every parent can put into place, and it just helps the child be independent and helps the child have success. And then in schools, it's meeting the child at their level. Instead of trying to constantly bring the child up to a level they're not at, meet them at their level. Put in the extra supports at the child's level. And if this means that the child takes longer to read, let's say, then that's okay. It's meeting them at their level, go at the child's pace. And then when you can, the child's interests are key. So child-led learning. So if you want the child to succeed at something, put in things in place that go around the child's interests. So right now, I've got a 2.5-year-old. We are working on potty training. My child is really into dogs and being a dog. So his toileting chart and everything around toileting has to do with a dog. He gets a little reward after. We call it a dog treat. It's not a dog treat, not feeding him dog food, but it just goes with his interests and child-led learning. So by going with the kid's interests, the kid will buy in more and be more ready to learn and want to learn when it has to do at their level and with their interests.
Thank you. Dr. Lewis, I see you have something to say, but if I might add I just want to ask you to think about this when you're sharing as well. How does having an autistic child, how has that shaped your professional knowledge and the way you treat some of us patients that come into your office?
You know, I'm sitting here listening to you ladies, right? And let me start from the beginning, because you talk about my autistic son, but what about my self-diagnosed ADHD self and dyslexic self? So as you know, ladies were saying, Janica, your experience came last year coming to Symposium, but imagine now having gone through life, medical school, you know, working for a while, and now you're in a situation where you start having children coming in who need the preliminary assessment so they can go and get assessed for ADHD and dyslexia. And they're sitting there telling you their symptoms, and you're thinking, that sounds so familiar. Huh. Yes, I often mix up my letters. I often write words and forget to put down the first letter. I said, oh, this is something to it. And then, yes, having my son and observing certain behaviors and whatnot in him. So I think it starts with awareness, knowing that something is not wrong, because we don't want to call it wrong, but something is different. Because once you start to recognize that something is different, then you're going to take the next steps. So very often, we get referrals. You guys know I work at the Wellness Center. We're, you know, a multidisciplinary clinic, so we have a behavioral health side, we have a medical side. So normally we will get referrals from the school counselors or even parents who have a, you know, who have a concern about their child and the child is not doing well in school and they want to get the child tested. And that honestly is the first step, recognizing that something is wrong, and then you're going to try and find a way to have the exact assessment done of your child. Part of the assessment, like I said, is also having them have a medical assessment, because I think they were talking about in the screening about their vision. I've been wearing glasses since I was 9 years old, so a lot of times I think that my problems with spelling was because I couldn't see properly, and I didn't recognize it was because I wasn't processing properly. But you need to have those medical assessments done, because you need to make sure that the medical reason is not why the child is struggling with reading and spelling. On top of that, we recommend certain blood work to be done. Just a regular blood check that we normally do, your kidney, liver, you know, that kind of thing, a urine test. But especially for kids with ADHD, we emphasize doing a thyroid function. Because again, medical conditions can mimic what is going on psychologically, and you don't want to miss anything. So yes, it is, like I said, it's important to have the awareness, and then you take the next steps and you go through the whole process of having your screening and whatnot done. And I want to hear from Janica what it's been like for her, having had diagnosis and having that support, because I will admit that I didn't have that growing up. And like I said, it was when I was into my 40s already that I started recognizing that something was a bit off. I asked to be tested, and I was told that at this stage I would have too many compensatory mechanisms for them to really be able to, I think, fully diagnose me. So I am so impressed that I'm jealous. I'm a little jealous right now. So I want to hear her experience and how that went. I'm being selfish, I've taken over the whole of time.
So, let me ask a question. You guys know how much symptoms you're supposed to have to be diagnosed with ADHD? Anybody? No? So it's at least 6. I want somebody to take a wild guess how much I was diagnosed with. So I do cheesecakes. The winner will get a tray of cheesecakes. How much?
We have 15 over there.
Someone said 14. That is very close, but that's not it. I was diagnosed. How much? No. You have to have 6 or more to be diagnosed. No. How much? No. So I was diagnosed with 12 symptoms. You said 12?
No.
I heard 14 was the closest. Sorry. When Doc told me 12, I said, what? I don't answer people, so I saw it's a respectable young lady. I would say, pardon me, sir. I said, what? Doc, what are you talking about? Like who? Me? He said 12, and he would listen, and he was like, no, wait, I have more. I said, no, Doc. It was emotional for me because, hello? It was emotional for me because sometimes I feel like I didn't have the support growing up. And everything my son went going through, I realized, okay, well, yes, that's me. My report books, Miss Dawson, my report books, all my past teachers could tell you. She's talkative, she's disruptive, yes, she's getting her work done. If I fly past, she... But I want willful, but my mother ain't see it that way. So it was kind of like, so mommy, no teacher couldn't tell my mother, well, something like was different. Doc, correct. Doc told me, take that out your mind. That wasn't even in existence for us at that point. So that kind of calmed me a bit. Okay, so I kind of can't blame the teachers, I can't blame my mother. So where are we going from there? So 12 diagnosed. So what are we going to do now? Doc told me we ain't even got to do no other tests because at that point, I'm severe. So we're going, next step, Dr. Tono. What are we going to do with Dr. Tono? Medication. So I can do something, even when my son, Simone, even when they were like, your son have to go on medications, I wasn't too sure about that. Yes, 2018 to probably 2024. Yeah, I was like, no. Because you're hearing different reviews, yes, you do your own research, but what exactly is going to take place when he starts taking medication? Is he going to be all right? So I had a couple worries. I ain't sure about me yet, but we had a couple worries about, what effect it's going to build on him. So I said, okay, let me try. I could have seen a bit of difference, but again, you have to know the child. Yes, he takes the medication, he's a bit calm. Okay, he's a bit focused. Okay, so what else do we need? Do we need anything else pertaining to that? I don't think so. Simone was like, give it a try. I was like, okay. And that helped a bit. It helped a bit to my mind relax. Because, of course, you'll hear drugs in children's system and you're thinking negative, or somebody else might tell you, man, you might got a child like a zombie. He ain't gonna be. Those were feedbacks I was getting. What if you... So I gave it a try, and that helped. My 35-year-old self, a wife, 14 years of marriage, children, it's a lot. When I was diagnosed, I told my husband, can you go back to our first time, I guess, getting in a relationship to now? What could you absorb? I guess having a bit of a knowledge, because of course we're dealing with our son, to me. He was like, oh, so when I say, so Jenny ain't seen nothing there? He's seen it too. We might be flipping because remember, we don't know, we don't have the knowledge. So he's like, okay, so now I have to take a turn. My husband turned, it's for the good because he realized, okay, well, I might need help with a bit more reminder, but I feel like I so independent. I don't want it to be that way. I don't. Why are you watching me like that? You zoom in, because I don't do that for 35 years. So yes, I'm trying to get it more, I guess, organized, be more organized. Even telling my manager at work, the day I was diagnosed, I told her. She said, her response was, oh, that's why. And then she said, it makes sense now. So that part would be the support. So my husband, I told my family. They was like, yeah, I know that. I was like, so why you ain't tell me nothing? Like, so what made you, what was signs? This is my aunt. What was signs that made you knew that I was, like, something was different? She was like, because Jen, you were hype, man. You got to be doing 10 million things. But I never knew nothing until dealing with my son. So yes, you wouldn't even see it. Yes, I just feel like, okay, I probably struggling in school. Like, why are you struggling in school? I went to the dean because I was stressed out. I went to the dean at college because I feel like the stuff that I'm reading, I ain't retaining it. It's not there. I would just write my name on the paper. Like, Jen, when you come out, everything coming to you. I used to say I was probably anxious, but that wasn't the case. So I just thought I needed help, but just not know what help or who to talk to or anything to that extent. So back to my manager. So I work at BVI Ports Authority. We actually have, with wellness center where they give different assistance, or if you need therapy, or if you need to speak to, I guess, a specialist. So when I was diagnosed, I said, okay, well, Doc told me to just, I guess, give them the information, and then they would, do certain coverage and stuff like that. In one of our groups earlier, someone mentioned HR, I guess, being involved or getting more information, because it have persons in the workplace that you're going through these stuff and you don't know, you're not having this support. They're just like, okay, you're in on time. I gave you some stuff to do. It's not ready, yada, yada, and penalized. But there's a reason, it's something back of it. What can we do moving forward? So that's my little piece to answer in a lump sum. Yes.
And there, ladies and gentlemen, is your ADHD response to that question. Well, unlike Taija, I have a team that's frantically waving signs at me to keep me on time, because I will tell you a story too. However, I would just say, Jen, what do I call you? She has touched on so many things that's parallel to my life as well, and which is why I think last symposium, when you came up to me, we were right back there, and you broke down in tears, and she's like, you're not leaving, I need to talk to you. And we spoke, and a lot has changed for your son since that conversation. And so today, he's here, right? Is he not? He's downstairs. He's a volunteer here, ladies and gentlemen, with the kids, yeah. And Jen has been doing an amazing job with him. It's never gonna be perfect. You're not gonna get it right all the time, and especially as a mom with ADHD yourself, you kind of struggle to remember to do the thing you know you're supposed to do and to keep doing it consistently. So, and there's the procrastination and all of that. So when Jen called me and told me she got diagnosed, I thought, kudos to you, because now she's moving towards finding out how she can be an even better mom to her son, that she's discovering these things about, by discovering things about herself. So, there's the timer walking by there. So that's just a warning so I don't go down my rabbit hole of a story. And so I think the question I want to ask the panel now is, Dr. George, so you were in the thick of it when, as you put it, there wasn't a whole lot of awareness around what Jen was experiencing or what I was experiencing in school. And now we're seeing a lot of transformation with all the work we're doing in the community, with the team we have now in education. Let's jump ahead to the future. What do you see as a way we can continue to build and even make it better for students like us, where we don't slip through the cracks and become that problem child on the street or something?
All right, thank you for that question. I think one of the main things is to get our teachers, all teachers, aware of what this is. So you're talking here. So you do not have to be, as they would call it, a special education teacher. But within each classroom, the teacher should be aware of the daily routines and what to look for, what to see. And then we talk about further, the second thing I want to mention is not just the teacher, but the entire community also need to become aware. Some more exposure to the ability for students to function, be effective, but not doing it all the same way. I think one of the things, we have this stereotype of how learning is supposed to happen, and the truth is, it's not going to happen that way for all students. And a child is not dumb because they're not doing it the way you say to do it. But there are variety and ways in which. So these are, it's like education. Somehow I have to speak education, Miss Simia. But education is key to a lot of getting us to realize what the changes are. We look at peer inclusion. I remember when we started the inclusive classroom, it was a big thing for some teachers to embrace and even parents to embrace. But again, removing that stigma of separating students is going to be important. And we begin to facilitate variety of students, so differentiated learning and instruction within the same classroom. Because the truth is, some students do not need that, what I should call isolated learning, but the inclusion where they can learn from their peers and watch their peers and see how they're doing things will help them as well.
Yeah. Excellent, excellent. Thank you so much for that.
Coach.
Kate, I'm going to jump over to you again since we're in education. One of the things we face is communication challenges and cultural conflicts in our school, and you're at an international school, right? So you have a multiplicity of cultures there. How do you help parents and teachers bridge that communication gap when emotions are high and stigma gets in the way, especially when it comes to the culture of it? Yeah. What are some of the things you do as a counselor when you have to say to a parent, look, we need to do something here? How do you cross that?
So, yeah, it depends on the parent. But also, I mean, I said meeting the kid at their level, meet the parents at their level as well. So some parents might not be ready for it, but with the screening and early intervention, since we know it's key, if you're a teacher, you can always say, hey, take your kid to get their hearing test. Take your kid to get their eyes tested, because that's a way in. You're not saying your kid has ADHD, you're giving them an avenue where they can go and a medical professional will pick up on if they're saying, hey, the school's thinking my kid's not hearing so well, then the medical professional community, and correct me if I'm wrong, can kind of pick up on that. So if there's parents that aren't ready to hear that yet, but it's more about keeping the parents up to date of what's happening in the classroom, and just that kind of open, honest communication is key. So if you think there's early signs, because early intervention is so key here, then it's letting the parents know, like, oh, even if you don't know what's going on, you can say, there's something going on. We're not sure what it is. We're trying to figure it out. Let's start with the basics. Let's start with going to your pediatrician. Let's build from there. Educational psychologists are brilliant, and the whole battery of an ed psych test will give you all of the data, and it's just so helpful for you as a parent to have in life as well as the school to have. And then you can kind of build on that. You can write IEPs from all of the data. So it's just kind of building the parents up to that. And then an IEP is a wonderful document. It doesn't mean that your kid is going to not succeed in school. It just means that your kid is learning differently from other children, but there's probably a whole bunch of kids in the class who are also learning differently. So when you implement some of these kind of recommendations in the classroom, it's not just benefiting one child, it's benefiting a whole group of kids.
Thank you. Absolutely. There were some gems in there, right, ladies and gentlemen? I mean, you've had those conversations. I see the educators nodding. They're like, yeah, it's really hard to bring this up at a parent, especially when it might be a parent like me who might just say, you just don't know how to teach my child. Uh, yeah, on a serious note, I think it's absolutely important that we just get the conversation started. And I do want to pivot to the medical part with you. It's not passing the buck to the doctors, it's just ensuring that they step into that space. But before you answer Dr. Lewis, I'll just say, I know we're out of time. I think lunch is ready back there, and we're gonna keep talking with each other over lunch. But I just wanna ask this one question. How do you see the medical community supporting these neurodivergent families, especially when they're at that stage that Kate mentioned? They don't know it yet. They are, but they don't know it yet. How do you see yourself and your peers supporting?
So I will be the first to admit that when you go through medical school, there are a lot of things, you cannot specialize in everything. When I went through medical school, my exposure to neurodivergency was in my pediatrics rotation. And, you know, we had to observe a child, for example, with autism. And I think when we had the play session today, they said if you've met one autistic child, you've met one autistic child. The thing is, though, to emphasize, I think we just need to emphasize that when you pick up on something being wrong, and I will say this for any condition, to be honest, whether it's neurodivergent or a chronic disease or something, to be discerning enough to realize that something is wrong. So if it's above your capacity, feel free, please, to pass it on. As a GP, I am a master, I'm a jack of all trades, but I might not necessarily be a master of all. And so if I pick up on something and I know it's above me, then I'm gonna refer it to a pediatrician. So I think that interaction has to happen. Also being able to refer to these specialists, because again, medical doctors are not the specialists when it comes to these neurodivergent conditions. We can rule out that that is not something else, but when it comes to diagnosing these situations, you have to work along with the psychologists and the educational therapists. You have to know, again, it's above you, and to be able to refer to the persons who are really going to give that child the best outcome. So in terms of what you were saying, one of the things I like to do actually when I have parents come in, number one, I share my own experience. I'm an open book a lot of times, and I will tell people about my own experience. I will tell them, like, listen, I'm dyslexic. I applaud you as a parent for bringing your child in, because I didn't even know, much less have the facilities available to be able to get help when I was a child. So I applaud families when they bring their child in, and I'd be like, if I could make it to where I am now without any of the supports that I had, imagine what your child is going to be able to do. So I think that's the attitude we need to have when it comes to our kids, that we need to do and give them every advantage that they deserve.
I think this is a mic drop moment. I won't actually drop the mic, but you know, this is absolutely true. Thank you for speaking that truth. It's lunchtime. I won't keep you from your food, but our panelists are around. Let's give them a round of applause, ladies and gentlemen. Thank you. We can have a chit chat over lunch, and so yeah, lunch is served. Enjoy. We will have one conversation over lunch, but you just feel free to have something to eat. Thank you. so we built on that, and it grew and it became a movement, a network of parents, teachers, doctors, therapists, amazing philanthropists like Brittany, who just step up and say, look, we're going to do something for these kids, we're going to do something for parents like me, and just make the journey a little bit easier. And so when I met with Brittany and Ashley, and they told me about this amazing idea about benefits of using horses and how equine therapy can help us parents as well as children regulate, I thought, well, yeah, you're doing this. So Ashley will tell us a bit about that.
No, horses have the innate ability to help us regulate. They are wired in their system to pick up on changes of energy in their environment. So as they learn our energies, they'll adapt to us. It teaches us a sense of calm. It teaches us a sense of presence. With these children and with anybody really, just being around them helps regulate our heartbeat. Horses' hearts beat slower than ours. They're larger. They don't have to pump as quick as ours. And just being around them and having that sense of awe of their power really helps. With any adult or child that has special needs, you can also work in hippotherapy, which works with their physical therapists and occupational therapists, increasing balance, range of motion. You can do equine assisted learning and development, so you work with speech therapists and work on simple words and motions. And also self-confidence. You can set up simple obstacles and have them achieve something that they feel so much greater than themselves. And with those little small steps, it really turns into something that is big and amazing.
And it's just so beautiful to see. So our slogan down here is one person's opinion of you does not have to become your future. And these horses are all rescues themselves. This is an initiative under our nonprofit Aerial Recovery. And they are rescues. They learn to trust again. They are put through their own healing program. And once they are healed, they're then used to help heal and progress others. We utilize them for our veterans. We are now using them for the children with special needs in Lemonade on Tortola. And we love the partnership because it's just full circle. One person said that these horses, these zebras were worthless, nobody would ever want them, and threw them away. And when they're here, people see how beautiful, cherished, wanted, and needed they are. And so we are so grateful to be able to share that gift with other people who get to experience this ranch.
Absolutely, and honestly, we see that a lot with our kids in the community, kids with special needs. Parents are hiding them away, they're not taking them to school, they're not taking them out into social situations. Like these horses, they may also be considered outcasts, but they're not. They're beautiful, they're amazing, they've got lots to offer, and we're making those opportunities available to them. So anytime you're ready, just reach out to Lemonade, reach out to Brittany and her team. We're ready to take you with us on this journey.
Imagine trying to grab water with your bare hands. No matter how tightly you clench, it slips through your fingers, leaving you with just a damp, frustrated grip. That's often what living with ADHD can feel like. It's not a lack of effort, not a flaw in character, and certainly not something you can just try harder to overcome. It's a neurological reality, a different way the brain is wired, and it impacts everything from focus to emotional regulation. For years, ADHD was dismissed as a problem with hyperactive kids who couldn't sit still, but that's a dangerously narrow view. The truth is, ADHD is complex, multifaceted, and manifests in countless ways. It's a spectrum, and understanding its symptoms is the first step toward managing it, embracing its unique aspects, and ultimately, thriving with it. In this video, we're diving deep, pulling back the curtain on every major ADHD symptom, explaining what they truly mean and why they matter. So, if you've ever felt like your brain is running a marathon while your body is stuck in quicksand, or that your internal world is a whirlwind of brilliant ideas and frustrating missteps, then this is for you. Let's unpack the reality of ADHD, one symptom at a time. Symptom 1, the elusive nature of focus. Inattention. When people think of ADHD, inattention is often the first thing that comes to mind. But it's not simply not paying attention. It's more like your brain has 1,000 open tabs, and they're all vying for your attention simultaneously. Imagine trying to read a book while a dozen other conversations are happening around you. A TV is blaring, and a dozen thoughts about what you need to do later are screaming for acknowledgement. It's not that you can't focus, it's that your focus is constantly being pulled in different directions. This can look like difficulty sustaining attention on tasks, even those you find interesting, making careless mistakes, not listening when spoken to directly, failing to follow through on instructions, or easily getting sidetracked. It's the constant battle against a wandering mind, the internal tug of war between what you should be doing and what your brain wants to do. The world is too interesting, and every stimulus becomes an invitation for exploration. Symptom 2, the restless spirit, hyperactivity. While not every person with ADHD experiences significant hyperactivity, it's a hallmark symptom, especially in childhood. But it's not always about bouncing off the walls. For adults, hyperactivity often internalizes. It can manifest as an inner restlessness, a feeling of being driven by a motor, even when you're sitting still. It might be fidgeting, tapping, pacing, or an overwhelming urge to always be doing something. It's the constant need for movement, even subtle. This can make quiet activities difficult, lead to excessive talking, or a general feeling of being unable to truly relax. It's the physical manifestation of an overactive brain, the body mirroring the mind's unceasing hum. This isn't a choice. It's an intrinsic drive that demands an outlet. Symptom 3, the impulse control challenge, impulsivity. This symptom can be incredibly challenging and often misunderstood. Impulsivity means acting without thinking through the consequences. This isn't recklessness for the thrill of it. It's a breakdown in the brain's stop mechanism. It can lead to blurting out answers, interrupting conversations, making hasty decisions, overspending, or engaging in risky behaviors without proper foresight. It's the inability to hit the brakes before the thought becomes an action. This can strain relationships, create financial difficulties, and lead to regret. The pause button in the brain, which allows for reflection and consideration, often feels broken. The immediate urge takes precedence, and the future consequences only become clear in hindsight. Symptom 4, the time warp, time blindness. This is one of the most frustrating and often overlooked symptoms. Time blindness isn't just being bad at managing time. It's a fundamental difficulty in perceiving and estimating its passage. For someone with ADHD, time isn't a linear progression. It's more like a series of nows. The past is a vague memory, and the future is an abstract concept that feels perpetually far away until it's suddenly upon you. This leads to chronic lateness, underestimating how long tasks will take, difficulty planning, and missing deadlines. A deadline that feels weeks away can suddenly be tomorrow, and the urgency only kicks in when it's too late. It's like living in a perpetual present, where the clock is always playing tricks on your perception. Symptom 5, the emotional roller coaster, emotional dysregulation. While not officially part of the diagnostic criteria in some manuals, emotional dysregulation is a profoundly impactful symptom for many with ADHD. This means experiencing emotions intensely and having difficulty regulating their expression. Small frustrations can escalate into explosive anger. Minor setbacks can trigger deep sadness, and joy can be overwhelming. It's not that emotions are wrong, it's that the internal thermostat for emotional responses is skewed. This can lead to frequent mood swings, irritability, low frustration tolerance, and an inability to bounce back from emotional upsets quickly. It's like living with an exposed nerve ending, where every emotional experience is amplified, and the ability to self-soothe is compromised. The world feels more intense, and your reactions often mirror that intensity. Symptom 6, the struggle to start, task initiation, difficulty. This isn't about laziness. It's about the brain's ability to kickstart action. Task initiation difficulty means knowing what you need to do, wanting to do it, but feeling an invisible wall between your intention and action. It's like standing at the edge of a swimming pool, desperate to get in, but unable to take the first step. This can manifest as procrastination, leaving tasks unfinished, or feeling paralyzed by overwhelming to-do lists. The friction required to begin a task, even a simple one, can feel insurmountable. This often leads to feelings of guilt and shame, as others may perceive it as a lack of motivation, when in reality, it's a neurological hurdle. The path from thought to action is cluttered with invisible obstacles.
In 2
Symptom
minutes
7,
we'll be connected.
the memory maze. Working memory deficits. Working
just
memory is like
transitioning
your
from
brain's
live feed
temporary
to
notepad,
Zoom
where you
sometimes,
hold
so,
information to manipulate.
Sure.
For those with
And
ADHD, this
yeah, no
notepad
problem.
often feels
Will people
incredibly
be able to
small
hear me, or
or
do I need to
leaky.
do anything?
This means
Sorry?
difficulty remembering instructions. SD is an intense emotional pain in
She's like,
response to
that's a lot
perceived or
glitter.
tell me them ain't ready to go. Come in and late time today. Hey, hon. You going? Where you, Charlie?
Yo, what's up? She'll be fed. She can get food downstairs. Okay, good, good. Just check it. She's in good hands. Thank you, thank you.
Who you need?
For the boy, you club, yeah.
Exactly. I don't know what. Plantain chicken. Huh? Barbecue and plantain? Yes. Yes. I just got a pen.
Okay, let's take a break. Get out of here. Go wrong. Thank you. Thank you for taking me to my baby stage, eh? Lemonade order is bringing this back.
Thank you.
Oh, these are drinks.
You get what you want? Yeah, yeah, yeah. Get what you want.
No, no, I will put this down. Okay.
I yes, around that. I will try work it out a kind of a way. Thank you so much. I appreciate it. Oh.
Yeah, man. My concern.
clips and folded pieces of paper
Testing.
and an eraser, and suddenly makes an entire city out of it.
Can you say
It
something,
might
Michael,
also
so
be
we
the
can-
child who, when
Yep.
you put
Can you
them
hear me?
on the stage, they
Testing,
suddenly
testing,
come
1,
to
2,
life,
3.
and they have this physical presence where they
I think
can
we're still hearing
move
the
their
video
body
feed.
in a way that really expresses something. They also could be the child that on the sports field seems to have this premonition of how things
one
are
more
going
second.
to work. The child that can predict where the ball is going to.
Say something. Hello?
Hello?
Ah.
Testing, testing, 1, 2, 3.
And here we are.
Sure.
Awesome. So, hello again, everyone. I know we're still making our way around with lunch and enjoying lovely conversations with each other. I just invite you to listen in to a conversation I'm going to have with a dear friend of mine and former colleague, Michael Hall. He is a corporate lawyer, and so we worked together in that space for a few years, I think.
Yeah.
So Micah was also diagnosed with ADHD, and he's here to share with us his perspectives on ADHD in the workplace. So we're pivoting a little bit away from the learning environment to what happens once they're out of school and they're now older and they're in the workplace, how it's evolving. I think hopefully, Micah, it's evolving.
Yeah.
And what are some of those things you'd like to share with us today?
Yeah.
So without further ado, Micah.
Okay. Well, I think that the first thing I would say is hello and welcome to everybody. Thank you for listening to me. I think the starting point for me is that we need to remember how much of a disability ADHD is, and therefore, if you are in the workplace, congratulations, because lots of people with ADHD do not get that far, so there are, the statistics are really quite frightening. There's in the UK, they've done quite a lot of screening of different populations, and there's 1 in 4 of the prison population has ADHD. So it's 38.5% of people with common mental health conditions have ADHD. It's 28.5% of people who have problem debt have ADHD. And in the when they look at the proportion of the population who are working, it's 33% for ADHD are working full time in the UK, and the control group, for reference, was 59%. So far more likely to end up, going down the wrong path. There's a number of force multipliers that hit you, which I think people have to bear in mind. So one of the reasons why I stress this is because I find that a lot of people, a lot of managers, a lot of employers tend to come from a generation where they've heard of ADHD and they think, oh, this is that thing where you can't really concentrate. So we need to talk about a to-do list. And that's kind of it. And they don't realize that actually what you're talking about is a life-affecting and life-altering disability that has, upsides and downsides. And so, the fact that you've got into the workplace and the fact that you've got into a profession, for instance, means that, actually, you're doing really well just to be there, just to turn up. And, just when you were talking about children, I heard a statistic the other day from a study, which was that it's about rejection sensitive dysphoria. And it says that a child with ADHD will get criticized 20,000 more times during their childhood than a non-ADHD child. And you think about the cumulative effect of that. By the time you've reached the workplace, you're already feeling that you're kind of, behind the 8 ball a bit. And so, you know, just entering into the workplace, I think we've got to bear in mind, and what we need to kind of start expecting from people is that they're not going to tell us, oh, okay, so you want us to send you things on an email? That's not really it. You know, you need to reimagine the workplace to get the best out of ADHD people, because they can bring so much to your organization, but you really have to take it a bit more seriously than, you know, oh, do you want to wear some headphones? You know, that's, you know, yes, I do want to wear some headphones, but really, I want, you know, my work to work in the way that actually I'm going to be able to do it, and that I'm going to really impress the hell out of you, and not just, you know, be given a to-do list. So, you know, very, very heavy, I know, in terms of introductions and everything, but the, you know, as I say, there are the force multipliers which always, I think, get left out, which is that, of course, if you've got ADHD and you're born in a low socioeconomic condition, or if you've got ADHD and you come from an ethnic minority, that all of these things, if you're in a minority or a group that finds it hard to go up the ladder and achieve things, if you are in that group and you've got ADHD, it's even harder. But you know what? There's nobody more determined than people with ADHD. What they need is a chance. So,
thank you. You said that very well, because even as we speak about the effects of this negative language towards those of us living with ADHD, one of the things that we experience is that oftentimes we're more sensitive to criticism, we're more sensitive to even feedback on our work. So I remember once realizing that I couldn't even take constructive criticism, like during PDRs. Like I was very defensive. Like, what are you talking about? All these other amazing things happen, you know? And so
yeah,
it's really hard. And I think we perhaps need to start thinking, as you said, reimagining work. How then do we channel even feedback in a person with ADHD in the workplace? Do you have any thoughts on that?
Yeah, so I think, you know, as I say, the rejection sensitivity is an enormous part of ADHD. You know, if I make, you know, and if the standard that we hold ourselves to is often unrealistically high, and therefore when we don't meet that standard and somebody points it out, then we will be devastated. If I feel I've made a mistake at work, I will feel devastated, even if there are no consequences, even if it's, you know, that I have got a date wrong on a letter or misspelt someone's name or something like that. I will feel terrible. I will go home feeling very depressed and down about myself for having made that mistake. And is that rational? Is it right? No, of course it's not. But it is what I am. And I think it's probably the same for an awful lot of ADHD people. One thing that I think actually is an amazing observation to me when I was thinking about what we were going to say today is that obviously I've only been a lawyer for 4 years, but I've been on my legal journey for kind of 10 years. And I have met quite a few female lawyers who have ADHD, but I've never met one male lawyer who has ADHD.
That's interesting.
It's a very weird thing. And what it comes down to is the point you're making. I think it's down to the fact that there's judgment of ADHD. It's not that it's a disability in the same way as there's judgment of addiction, which is obviously, you know, another ADHD issue. But there's judgment of how you are, how you behave, and this is how all of those people end up, you know, in prison or in treatment centers or whatever it is. It's because they are judged. Their disability is not accounted for. It's judged. You know, so okay, you're a naughty kid, but you've got an excuse that you're ADHD, but that's not a real excuse because you still have to learn to behave. So therefore, we're going to treat you like a normal person, and we're going to subject you to all the normal punishments and everything you get. and it's just going to be a mere cipher, rather than reimagining the fact that actually, you know, we are not like this because we chose to be. We are like this because that's the way we were born, and we were, we're different people, to some other people. We work in different ways, and we think in different ways. And I think, as I say, that's why, it's really important to take account of that judgment piece. And I would say that to everybody, particularly with young people, you've got to take the judgment out of the way that they do things. That, they don't always do their homework at all, or on time, or very well, or whatever it might be. But, don't judge them for that. You've got to help people, not judge them, assist them, because they are carrying, it's like being tied to a fridge every day and having to tug it around the streets. You can imagine this enormous weight that you carry that makes everything more difficult for you to do, than for ordinary people, and so basically, I think that this, the judgment is the key thing, and that carries over into work, and that attitude is why when you get feedback, it's obvious. Usually it isn't constructive feedback. And that's why I think you say you're unable to take it. It's because it's not constructive feedback. It's just criticism. And that's what it is, with no appreciation of who you are.
I mean, I've had both, Micah. I've had the constructive criticism, I've had the judgment. And absolutely, it was really, really hard in the workplace, and which is why I really wanted to talk about this, particularly because I spent a significant amount of time in the legal industry, or what we call the financial industry here, financial services industry. And, as a corporate lawyer, you get what I mean by that. There are deliverables, you have to meet your billing targets, and you've got to do all of this stuff that's around, making money, quite frankly. But there was, I felt there wasn't a space for even this conversation to happen until, fairly later on in my career, but also more significantly when I met you. I think I told you this. That day we were standing by the coffee machine, and I always wondered, he's always got headphones on. Is he listening to some kind of music? Like, what's going on there? I didn't understand yet what was happening there. And you opened up to me about your experience with ADHD and, just what it was like. And I remember feeling like there were so many parallels to that conversation. Here I am talking to this total stranger who's telling me things that sounds exactly like me. And I never was able to have this conversation, until now, in my 40s. And so you're absolutely right. You joked about it when you said you've never met a male ADHD lawyer, but I'm sure they're out there. They're just not going to say it because it'll be, shall I posit, it'll be career limiting to indicate that you have a disability.
I think you're absolutely right there, and it's sorry to, but that's so powerful what you just said, because the thing is that actually when people talk about reasonable adjustments, what they mean is reasonable adjustments so that you can work like us and be like us.
Exactly.
So that you can not be different. How do we make you like us? And the answer is you can't. I've found that I've just recently joined a new firm, and the thing is that I'm in a position where I've got a lot more responsibility and space. So, these are the two things that I would say are really, really so important in the workplace: is being able to take responsibility for things and having space. Because the more people try and micromanage you because they're worried that you might forget something, the more likely you are to make a mistake, in my experience.
It becomes this chicken or egg thing, right?
Yeah, and they need to get out of your face.
Yeah, I mean, let's explore that a little bit more because I must say, as a parent raising an ADHD child as well, I do a lot of micromanaging, which then irritates him, and he doesn't actually do what he needs to do. How do employers, I don't know, how do we get past that? Do you have any suggestions or solutions that you've thought about over the years?
I think is extremely difficult, particularly because, you know, obviously most people in senior management positions tend to be middle-aged white men with certain views, and that's quite a difficult thing to get round. Some of them obviously are enlightened and they've learned, and you know, some of them really want to learn but haven't, and you know, some of them do not believe it, don't believe in it, and think it's all a bit of a scam, and that it's a bit of an excuse for you to behave poorly and be more lazy than your peers or whatever it might be. And I think you've only got to look at the remote working thing. If you look at remote working, what people say about that, there's your proxy for ADHD. Because a lot of these middle-aged white men are saying, you know, oh, they've all got to get back into the office. They've got to get back into the office. You know, we've got to get them back in. And what they mean is, I think they're all skiving off at home. And of course, you know, again, I mean, you know, this is their attitude, is that, you know, you've got ADHD, you're getting away with something. You want to be able to do things slower. You want to have a crutch. You want to have extra time and extra marks in your exams. That's what you want. And, you know, that attitude, I think it's partly, you know, going to be solved by the evolutionary process, because none of us middle-aged white men are getting any younger. We're all progressing towards retirement, and a generation is coming up who have got more empathy and understanding.
Yeah.
But, you know, really, I think that the issue that I think a lot of us have is that, you know, I did a lot of senior management jobs, not in law, but in IT service management, you know, and so I was managing very large teams across very large geographies, had a huge amount of responsibility, a load of autonomy, and feel and was rewarded in a sense that I did very well in those jobs. You know, and the thing is that I think one of the things that ADHD people do is they make excellent managers because they are so empathetic, because they understand the effect of criticism. So if I was, as a manager, I managed hundreds and hundreds of people, and I never criticized one of them, because, you know, and I never gave them constructive criticism either. I said, here's how we work for you to get to the next level. These are the things that we're going to add to your game. That's what we're going to do. We're going to make this a positive conversation about how you can get to the next level. We're not going to come to you and say, you know what, you know, just constructive criticism. You did that. That was awful. And so, you know, that was really rubbish. So don't do that again. That is not constructive criticism. Constructive criticism is, you know, okay, so, you know, these are your development needs and everything. So we want to get you promoted. We both want to get you promoted. And so there's going to be some things that, you know, maybe courses we can send you on. Maybe you can shadow somebody who's really good at that, or whatever it is. You know, whatever it is, though, you know, you don't even have to tell them what the issue was, what they did wrong. You just need to tell them what they did right, because they don't need any more criticism in their life. They've had 20,000 more criticisms as a child, you know, that they're clumsy or lazy or naughty or whatever it is. They don't need any more criticism in their lives. ADHD people particularly. So I think that those are really the things that I would say. If you want ADHD people in your workplace to succeed, you give them responsibility, you give them space, right? And you let them define the objectives and that they're going to achieve the objectives. And you know what? They'll blow you away, because, you know, particularly, you know, they're oppositionally defined. They will not fail if they're in charge of it. But if you try and chip them away like a sculpture with a block of, you know, here's a block of marble, and I'm going to keep chipping away at it until you're Michelangelo's David. Never going to happen.
No.
What you're going to have is a very, very angry and depressed employee, you know. And I mean, I have to say, I always say this to people, you know, I'm a very stubborn and difficult person, which is why I do litigation, right? And the thing is that when I went to a grammar school in the UK, and I was beaten with a stick, right, a cane. I was beaten with a slipper. I was beaten with steel rulers. I was beaten with fists. I had board rubbers thrown at me. I had every kind of humiliation you could imagine to try and get me to comply. And the thing was, none of it worked. It all made me worse. It all made me angrier and more defiant, right? And I say to, you know, I've got 4 children of my own. 2 of them are ADHD. 2 of them are not. And as I've said to everybody, when they talk about my ADHD kids, I said, no, they haven't got to do that. You want them to do that? They haven't got to do that. They haven't got to do anything because they're a kid with ADHD, right? So you got to persuade them why it's in their interest to do it and help them do it. Don't try and order them to do it because then they just will not do it. You know, and it's about having that sophisticated kind of understanding of, you know, okay, we're gonna let you make your own choices and have your responsibility and organize your work day and have all the flexibility that you need. And then you'll get great performance from great people who really know how to do the job because they've really thought about it. But you'll never, ever micromanage them into, you know, I had a conversation with a partner upon joining a firm, and she said to me, well, what sort of reasonable adjustments do you need? And I said, well, firstly, I'd really like you to just send me things on an email. Even if you discuss it with me, if you could just confirm it to me in an email, shoot it to me so that I've got it to refer back to in case somebody else comes along and speaks to me immediately afterwards. And then, you know, maybe it goes out of my head. And she said, oh, I don't think that we can really guarantee to do that. That sounds like a lot of work. You're going to have to just fit in with our way of doing things. You know, it's like, if you're not even going to go that far, you know, to send a 2-line email summarizing what you want me to do, okay, then that workplace is just never going to work. And it, you know, really can be quite difficult. So, yeah. So space, I would say, autonomy, responsibility. That's what people need. They need to be trusted. They need to be assisted, and they do not need criticism. They really don't.
I really like that. Thank you, Micah. Thank you very much for sharing. I believe that these tools as well are also, you know, they're very relevant to even persons that are not neurodivergent or persons who don't have ADHD. You know, it's something that we should just practice in general to be better employers, better managers of people, because if you take the iceberg principle, for instance, when you see an iceberg floating out there, about 90% of it is underwater. You don't know. There's so much about people you don't know when they show up. They're only allowing you to see about 10% of themselves. There's a lot more going on under there. And I can tell you, a lot of what you've just said, you know, with ADHD, is really hard. I always say, I am my worst critic. I say to people, you can't insult me more than I could insult myself, or bring myself down more than you can, you know. You can't. You just simply can't. That's just not possible because I'm always my worst critic. So I think those tools you've shared with us about not micromanaging, giving a bit more autonomy, you know, I've experienced some of those things as well, and I've seen the growth even in my own personal development when those things happened. And so now I understand a bit more why that happened, why I was successful from what you just said. That's just the way our brains work. So I really appreciate you sharing with us today, and I thank you very much for your time. Do you have any time for questions from the audience?
Yeah, I have nothing on, and I have to say, if you want your son to sort his socks out, I would start by saying to him, "Would you like to wear socks or not? Your call." And
I like that.
If you want to wear socks, let's work out a plan for you to wear socks.
I like that. I like that. All right. So There you have it, ladies and gentlemen. Parenting tips, workplace tips from a lawyer living with ADHD. Does anyone have any questions for Micah today? Is there a question, or was that person just stretching after lunch over by the bleachers? Is there a question over there? No, I think she was just stretching. All right. I think you did a thorough job. Thank you very much, Micah. Let's give him a round of applause, ladies and gentlemen. Thank you very much. And I wish you the best. And hopefully we will see you back in this part of the ocean sometime soon.
I will look you up when I get there. Thank you.
All right. Thanks, Micah. Take care.
Bye. Bye.
Okay. So, it's after lunch. I think we should stand up. I just fell asleep there a little bit. Stand up. Let's stand up. Stretch those arms and those legs. Let's just make some movement going, because that was a really good lunch. You guys can sit or keep standing, up to you. I know this is helpful for me because, boy, after the food starts digesting, it just gets a little challenging to stay awake. And I don't have Lisa here today to do the game with you. Don't drop the ball. You guys remember that from last time? That was so much fun. Yeah, poor Lisa had a little bit of an injury, so she won't be able to be with us today. But we love you, Lisa. We're thinking about you. So I'm welcoming, we have another change in our program. I have, instead of Dr. Rubin, we have Dr. Josephine back on stage again, Dr. Claxton. All right, so we had on the schedule to talk a bit about, how do we support mental wellness in the neurodivergent community. So it's a little bit of a pivot, I know, but I think October being Mental Health Awareness Month, we can't not say something about it today, right? So I feel there's a lot to be said. We heard a lot about it as we were listening to our presenters today. You heard about how the ADHD brain works, bringing out anxiety and all these different things which can lead to other things like depression. And so I feel like sometimes we need to just take a pause. I feel like I should have LaToya on stage here, but I see she's busy helping some anxiety over there. But it's all right. It's all right. We're gonna get to you in a minute. But in the meantime, I do have Dr. Josephine Claxton here on stage, and I do want to hear a bit about your work and how do you find it's been helping with your clients and even the parents in terms of providing that support when they start compared to before they were with you.
Good afternoon, everyone. And I know people have eaten, and we normally get really tired after eating. And so this is the time when we think, oh, somebody's talking at us again. But the work we do is that we work with children with autism. And the center is called the Spectrum Services Center. Our work is mainly play. Well, it is play. We believe in fun with a capital F-U-N, fun. Play is where we all started from. And one of the things that we realize is that a lot of people forget how to play as they get older. As we get older, we tend to think that play is just something that children do or don't do. Because sometimes we'll say to them, stop playing. Stop playing. I said, stop playing. But when you stop playing, what do you do? What do you do when you stop playing? We work, and we work, and we work. And then when we look around, we've got older, and then we get tired, we get fatigued, and we forget that we can have fun. We don't do that anymore. We don't walk, we don't go and dance. You know, people enjoy dancing, but we don't do that. So play for us, it stands, P is play, L, capital L, is language, A is for autistic youngsters. Play and language for autistic youngsters. And through play, we've seen that we get engagement, shared attention, communication. So we get because it's about the social skills we're looking at, building the social skills for our children. We also coach the parents in how to work with children. Because, for example, some of the parents may come to the center and say, we're doing play, but they're looking at what academics. Because I don't know about the BVI, I don't know about Totola, but a lot of our parents are very academic. We feel that academics is what drives. But what's the foundation before academics? It's play. It's the foundation, it builds everything. And through play, we get to be able to communicate, negotiate, understand each other. Because there's a lot in play. And if we miss that gap, we've missed a lot. So that the reasoning skills as we get older, we can reason because we played a game that helped us to reason. And when we use those skills, it then enables us to be functional as we get older. And so if there's a problem, through play, we can problem solve. As we grow, we can problem solve for some of us. But there's some of the gaps that we have, and some people then can't do the problem solving, which then can lead to some of the antisocial behaviors which we may present today in society. So play is important. It's a foundation. So don't stop your children from playing. You join them and play and have fun, because it'll help to maintain some of our functional skills as well.
Okay, so oftentimes, you know, I will confess, I find some of the play the kids do these days to be boring. So I don't want to play with them. And then sometimes they just want to play video games. I don't want to do that either. How then do parents like me work around that?
Hello? Yeah. So the work that we do is that we follow the child's lead. So even though you might think their game is boring, if a child is playing with a car, how can you make that into an interactive game? Yeah? So there's the car. The child's playing with the car. Maybe just spinning the wheels of the car. Because a lot of our children will spin the wheels of the car. So how can we make that into following their lead still, get a car and do the same thing, and start singing what? So you might sing a song. So let me give you an example of a bus. The child has a toy bus. They're engaged with that toy bus, and over and over again they're playing with the toy bus. We can sing, the wheels on the bus go round and round, round and round, round and round. The wheels on the bus go round and round, all through the town. So we join them with that. So we've got into their space then, we've got into their world, and together we're sharing that activity. So it becomes a two-way process as well, not just the child playing on their own.
Sounds good. Sounds all right. That's some really good advice. Thank you. Um, is it okay if I open it up to the audience for some
Yes,
questions?
it is.
Yeah. All right. So you guys, some of you experienced the play therapy session with Josephine. Does anyone have any questions about what it is, for those of you especially who didn't get to go into her session? Or if you were in session and you ran out of time, do you have any questions you'd like to ask? That was your moment.
If the only thing a child wants to do is play with a toy car or toy bus, how do you then change from the car to something else? Because every time you see that child, the only thing the child wants to do is play with this bus. So how many lessons can you come up with from this bus before you can switch to something else? And if the child doesn't want to switch, what do you do in a situation like that?
Okay. A good question. So if the child doesn't want to switch, you can actually, sometimes we remove that car because we know that that's the interest, so we can get them to look at the other things. Because we've got a lot of toys in our room, too many actually, which makes it overstimulating. So the aim is not the car, the thing is the engagement and trying to get that engagement. And I often say it's human to human as opposed to that object. So we will, if we have to, the next session, make sure that the cars are not, or the bus is not in view, where there's other things in view that the child then can navigate towards. And if they don't do that, then we can actually look at, because we're looking at what the child's, where's the child's attention? So the child's attention is on Simone. So what's the intention? To talk to Simone? So we make that into an activity. Simone can start singing or just joining the child where the child is at and getting that engagement, because that's what's key. Where is the child's attention and intention?
Thank you. Any other questions? So, I mean, really good advice, but do you mind if I challenge?
I don't mind at all.
So, Pokemon is my daughter's current obsession. I can't see myself removing any Pokemon from her to try to get her to be interested in something else. I mean, how, like, it's like a real, I don't want to call it an obsession, but it's just what she's into right now.
But she's into that. So you then become interested in what she's, because the idea is that you become interested in what the child is doing. So that's it. We follow the child's lead. But the only thing we have to look at, is that causing the child a problem? And if it's not, then why are you changing it? It's when the children are not communicating with you or not, that's an obsessive thing, they're there all the time. So then you have to think about, well, what do I do to get that child to engage when they need to engage?
Yeah, but then when I try and then I get the names wrong, she tells people, my mom doesn't know anything about Pokemon. She tries, but she doesn't know anything about Pokemon. And so then it becomes this loop, this feedback loop of maybe you're trying too hard. And
you're teaching your child that you're human, because it's not everything we know. So at the end of the day, when they go out into the, because we want to be, they're going into the real world, hopefully. And then out there, people don't know everything. So you don't know everything, so you can actually say, Mama doesn't know everything. There's things that I make mistakes too. So you there's lessons in everything we do. It's how you deal with whatever the child might put at you, yeah? It's how you do deal with it.
So, okay. Simone, I feel your pain. Because our children have the same obsession, and that's why they're such good friends. But as I was sitting in the play session, something came to me, because I think one of the objectives we should have with play is for them to have, like, to improve on their social skills. I think and please, advise me on if I'm going in the right direction with this, but Pokemon all have different
characteristics. So I'm wondering if we can challenge our children to look and see who in their life might, if they had to name, they had to call that person a Pokemon, who would be Pikachu in their life? Who would be, let me not say any other names because I don't know them and I don't want to be incorrect either, but but if they could identify like the characteristics of a Pokemon, if they could kind of relate it to a person that they know, if that's going on in the right direction.
That could be, it's an interesting viewpoint, but it could be very dangerous because some of our children are quite blunt. So it would be, I don't know the names of Pokemon neither, but Simone would probably meet the person and say, what's the names? Anybody know the names of the Pokemon character? Nobody in here? Pikachu. So it says, so you do this in the home and you say, Auntie, they is Pikachu. So they go to Auntie Bear and they say, Pikachu. So how would she feel? So, yeah. So we can use them in a different way, but probably not at persons, I would say, yes?
Fascinating. Thank you. We will try. Charlotte and I will try.
Question. To what extent should, I wasn't in the play therapy session, to what extent should parents be involved in play therapy session? Do they come to every session, or they're limited in the amount of sessions that they can attend with their children in terms of you doing one-on-one, or the parents have to be at all the one-on-one sessions? To what extent are they involved in these play therapy sessions?
Okay. We would say 100%. But having said that, so we do coach the parents in how to work with their children. So parents come to the sessions. Because if we just do the sessions without the parents' involvement, how does that work carry on into the home? So we try and involve the parents, the school, we're involved in the school, and anybody else that works with the child. But having said that, we do find that sometimes when the parents are in the sessions, the children don't do anything. So there's times when we'll say to the parent, can you step outside of the session so that we can actually work with the child? And we allow them to look through the window so they can see what's going on. So it depends and it varies. So we have the children. We do encourage the parents to be in, but we will always let the parents know what we're doing with their child so they can do some of that, reinforce it outside of the therapy session.
Thank you.
Another question. So if the child has ADHD, but the child is a kinesthetic and a visual learner, the teacher now says that the child has to adopt that learning style of just being lectured to, but the child now only displays those two, which is kinesthetic and visual. Should the child be forced to learn that new learning style?
I do believe in, I don't know, teachers have been taught in what we call differentiated instruction. So I do believe that every classroom should be able to tailor teaching and learning to the child in the classroom, so that we should have different modes of teaching and learning. My staff will tell you, I mean, I'm not in the classroom anymore, but they'll tell you that I often say, we should have lovely stations where our children can go to if they need to, if they're learning this way. So you don't just have one mode of teaching, you have many different, so that each learning style can be actually catered to, if I want to use that word.
Okay, well, thank you for the questions, everyone, and for engaging with Josephine, especially stumping her a little bit there just now.
No, I was laughing because I was thinking about
You could just be you. But you did say you have a poem you'd like to share with us today, and so we're in for a treat.
Yes, I wrote this poem a couple of days ago. It's entitled, Here We Go Again, Living with ADHD. So I start to walk. The doctor says I have something called ADHD, Attention Deficit Hyperactivity Disorder. What does it look like? It looks like me, struggle. The boy who's always in trouble. The one who's told he's badly behaved, rude, lazy, a troublemaker. But that's not who I am. Some people say ADHD is just an excuse, that I'm just being difficult, that I don't care. But please try to understand. I'm trying to sit still, trying to focus, trying not to get into trouble again. I'm not a bad child. I'm just a child whose body needs to move, whose brain moves faster than his seat. So next time you see me stand, fidget, or talk too soon, don't see bad, see trying, see me. Because I'm not giving up. Even when it's hard, I'm trying. Thank you. From struggle.
Thank you very much, Dr. Josephine. All right, so you guys should know that tomorrow we'll be having a session in Virgin Gorda on play therapy with Dr. Josephine and Rosemary. And so if anyone would like to come join us over there, you can. We are also working on getting a session done on Monday afternoon after work. That hasn't been confirmed as yet, so on Tortola, not Virgin Gorda. So the second one, we're trying to do one in Tortola before they leave on Tuesday, but we're very eternally grateful for you and this fresh perspective you brought to our symposium and even to our minds here in the BVI. We truly appreciate you. And so thank you. Thank you very much. And Rose. Come on, Rose. Come on up.
I want to just show some of the books that we use in the center. So teachers or parents, just some of the resources. Ms. Monroe wants to bring them up.
Do you want to put any on the resource table?
Yeah, we can do, yeah. We can put them on the resource table if you want to have a look, but.
So we'll be having an open house after the session is over, and you can go over there and you can speak with you guys wrote the books, or did just? No, we didn't. Okay.
We didn't write the books, but we're looking at doing our own thing very, very soon, hopefully.
Awesome, thank you. But you can, of course, ask questions as they come up. All right, thank you very much. Please give her a round of applause. All right, so we're getting there. One more panel. Okay. You're back? Okay, all right, no problem, no problem. Come on up. Okay, so this one is meant to be another spicy topic. This one is about speaking kind words to ourselves and our dyslexic thinkers. So some of you would have benefited from the dyslexia session with some of our panelists here, Mrs. Prescott and Kate, I believe you were both in a dyslexia session. Marsha Pemberton is a special education teacher and person extraordinaire in the neurodiversity space, as the kids and parents will tell you. And of course we have Latoya. Well, you guys know who she is if you've visited a spa back there. She is also an amazing human who, She studied psychology. She's got a lot of other things going on in that brain. And she's going to talk with us a bit about how we get into our most positive space today. So let's start with Kate. Hi. So this is because of the topic we're addressing here. As a school counselor, you likely come across these situations where a dyslexic student may, they're already at a disadvantage because of the way education is structured, and they're feeling poorly about it. They may be getting some pushback even at home about it, some challenges. When you encounter these situations, how do you deal with it, first of all?
Well, a lot of it is building that self-confidence with the kids, because a lot of kids will just kind of see, oh, you can't hear? Sorry. They will kind of see disability or being different from their peers, and they're comparing. Kids are constantly comparing themselves to others. And I always tell the kids that comparison is the thief of joy. Just do not compare yourself, because every child is a unique individual and should be treated as such. But it's about building that self-confidence and kind of building that positivity and seeing the strengths. Because kids with dyslexia, they have so many strengths. And it's about focusing on those strengths and building up all of the positives and showing them what they can kind of bring to the table and what they can bring to their own learning, because they might not see that on their own. So it's about just kind of getting away from the stereotypes and seeing the child for an individual and helping them build that self-confidence. That is key. Just compassion for themselves.
Yeah, that actually what you've just said is what really inspired this panel conversation, because we have two teachers here on the panel as well. And, teachers hear everything, right? Y'all know that. Your kids go to school and they tell them everything, in case you didn't know. So, oftentimes some of those things might be a little bit distressing to hear. And they may not know how to approach it with you, knowing that, your kid is basically tattling on you to them. So what Kate is talking about that kindness and building that confidence at home is really, really important, because it comes out in the classroom in the confidence and in the work. So as teachers, what are some of your experiences with this, if you'd like to share without, embarrassing anyone? And what have you done to support the children who may have had a negative experience at home, for instance?
Hi, good afternoon, everyone. As a teacher for younger students, I often hear a lot of stories. And as you say, without embarrassing anyone, I try to create a safe space, a low pressure environment for my students, because sometimes some of the things that they want to get off their chest, it's not necessarily easy for them to tell a parent or to tell a guardian. So when they come with that information, what I do, I try to make them feel safe. I try to make them feel settled. Okay, there's no pressure, and whatever it is that you're saying to me, you're saying it in confidence. If it is something that I need to relay, let's say something that's out of my reach, something I need to relay, I would go and I would relay to my principal. I would say, okay, this is the situation, and I think that this child needs a little bit extra at home. So then the principal would step in, and then they would contact the parents, because I'm going to be honest, some parents, certain things are hard for them to hear. So you have to make them feel safe and supported whenever you're delivering that information that the child or the children told you, without breaking the relationship between you and the child.
Marsha, do you?
Afternoon, everybody. To piggyback on what she said, you have to have that trust, because I tell my kids I have to report. If it's something that I have to report, I let them know I have to report it.
When I talking to my parents, I try to be as supportive because, like what she said, sometimes parents get very defensive, and students, children, I work more with the seniors, they express themselves a lot. And I try to keep it open. We use our journals, or they might just have that one-on-one conversation with me. And the things that I hear are heartbreaking at times because they feel about it within themselves, and then the parents might, say things, and then at home as well too. So I try to encourage positive stuff. In my class, I have affirmation. For my team, this says I can do hard things because it's going to get harder. And you might have a topic where it's a bit difficult, and I'll always reassure them that you can do it. So affirmation is a goal for me, for my students, and just encouraging them because they have feelings, and I want them to know that their feelings matter. How you feel matter about yourself because it shows in your parents, it shows the way they work in school, and even after school. So I always encourage parents to even involve them in after-school activities, church groups, to build that confidence because if you don't have that, it kills a lot for themselves and even as for parents as well too. I also encourage parents to seek additional help too for your child because sometimes the way they come off might be, I guess, rude and disrespectful, and sometimes it's just for them to express how they feel. And we want to encourage to express your feelings, but in a respectful way.
Yeah, that's really, really impactful. Because I always say I can't be a teacher because for obvious reasons. But I commend you guys and for what you do every day, and it can't be easy, especially now with the way classrooms look these days. And I think it gets harder when you feel like you're pushing a boulder uphill. You're doing all this positivity stuff, the stuff Kate just talked about as a counselor, both of you spoke about, inspiring, you talk about your affirmations. But that child still comes back to school the next day and they're like, yeah, I'm stupid, I can't read. And you're wondering, where is this coming from? Is there any advice, anything you'd want to say to parents on how best to, we get it. As parents, we get frustrated. We might say the wrong thing. It happens. But is there any advice you would give us as parents on how to deal with those difficult moments when the child simply, let's say they're dyslexic or having trouble reading or understanding, how do we help them without getting overly frustrated?
So I would say the first step is to take a breath. Slow down, take a breath, and try to see it through their eyes. Because if you as an adult, you're frustrated, what about the child? Now, if you don't slow down, where do you think all of that frustration is going to channel? Onto the child. So the first step is to slow down, take a breath, try to see and understand what they're trying to tell you, what they're trying to show you. And believe me, just by slowing down and listening or even observing, because sometimes, they really only want our ears. Sometimes they honestly just want our ears. So it's not a, don't do that, sit down there. It's more of, okay, I see you want to take a little walk around, let's take a stroll. And in doing that, it's like a glue. So you get what you want from them in the ending.
Yeah, exactly. And with any diagnosis, some parents go through a full-on grieving process. So you have to process that your child might learn differently than what you learned, or you see the signs in yourself as well. But counseling is key for parents because parenting is hard enough on its own without any additional needs. So if you have extras thrown at you and you're kind of already tapped out at that frustration level, then it's about getting the counseling and taking the self-care time for yourself as a parent, because that will better enable you to help somebody else.
I would also encourage just communicating with your child. Express to them how you feel as well, so they can understand that, okay, you make me sad just now, I'm sad. And then the child will be like, okay, I didn't realize that I did something I'm not supposed to do. And you open up that window with them. Communicate with the teacher. Check in, involve, be involved, so they can see that, okay, mom and dad is involved, so therefore I have an expectation to reach this goal, you know, stuff like that. Just communicate in all aspects.
So I heard well-being, and I'm going to pivot now to Latoya. Let's hear some of your thoughts on this, and especially as it relates to parents and us taking that moment for ourselves, that time for ourselves, and how important that is.
Good evening, everyone. How are you? Amazing. So before I say anything, let's start with a deep breath. And exhale. Let's do that again. And exhale. Now, you've learned a lot earlier, and this just gives you the opportunity to relax and learn. So many times as parents, we feel overwhelmed. Back in my time, when I was growing up, my parents had help. Nowadays, we don't have that much help, right? We don't have the community to rally around us and so on. But I love Lemonade because you are creating a community for parents to get help. But at home, when you're having the most difficult situation with your children, one of the things you need to remember is that they hear you. If you speak negative to them, they will believe you. They won't love you any less, but they will love themselves much less. And so it's very important that as parents, we do our affirmations. You might not be able to do it daily, but start off by helping them to know who they are. I am great. I can do all things through Christ who strengthens me. Say things that you know that will help them to be the best person. I like to tell my young son, you're very smart. You can do anything you put your hands to. He is 4 years old, and I involve him with every task we can put our hands on. He just helped vacuum my car the other day, washing the car. So I'm saying to you, get them involved. Help them to build that self-esteem, as our teacher said. Help them to build their self-esteem. As parents, you too need to know how to deal with your stress level. And one of the things you have a long day at work, you come home, soak your feet in some salt water. Put on the music, light the candle. For those of you who drink wine, have a glass of wine. It helps with your heart. For those of you like myself who don't drink wine, have a glass of something, cider, water, something with a little bit of lemon in it. Create that ambience for yourself. You can even give yourself a small self-massage, your neck, massage your neck. It makes a difference. It is the healing art of touch. I have so much to say, but is it okay if I get 2 more minutes to? Yeah. Yes, it's the healing art of touch. It's very important that we set aside time each week for yourself. I date myself, so I will make sure I'll do a little polish, change the nail polish on my toe. It makes a big difference. I feel like I win $1 million just to have my nail polish changed. Go another week, you can go and get a massage or go to the ocean. You have what we call magnesium in the salt water, and that helps you to relax as a parent. You can do time out for yourself. The gadgets that we are watching, it makes our mind overactive. Break from that gadget, take some time, do painting. I start painting, do some painting. Or I like to dance, so I go to dance class on Thursday. Free advertisement on Thursday. It's at UP's. I go to dance class. Yes, the adult. Yes, absolutely. Please, guys, go have some fun. You might not be able to dance, but use your tune knee and do it, man. It's so much fun. Have that hour to yourself. It's so much fun. It not only relaxes you, but it helps you to express yourself better, to clearly help your child. Because once you are relaxed, it makes the stress of the world easier to handle. Thank you.
Well said. Kate's afraid to follow that. What she said. Awesome. All right. So, I mean, as we know, it's you're absolutely right. And you're saying these things, and I'm reminding myself, okay, yeah, I need to start back doing some of those things, because boy, oh boy, the struggle is real. Marsha knows. But I want to highlight something Marsha said earlier, because I noticed her doing it. I don't know, you noticed me noticing you doing it with my daughter, first of all, she's autistic. Second of all, she's very direct. Third of all, she's becoming a teenager. Just imagine that combination, right? And so sometimes what we call it, the tude shows up, the attitude shows up. And Marsha don't play. So, but she does it in a kind way. She would say like, yeah, you hurt my feelings. So tell us a bit about that technique you use when speaking to someone like my daughter.
Okay, so before growing up, I was never expressive on how I feel, and I realized you keep that in, and then it come out the wrong way, and you come out to be rude and stuff. So as becoming a teacher, I realized that I'm encouraging to speak how you feel, however, in a respectful way. And if you make me sad, I'm gonna tell you, you make me sad. And they understand. Don't feel that they don't understand. They understand. So you talk to them, you'd speak to them, encourage them, and say, listen, we're not gonna do it this time. And they would be like, okay, all right, next time. I said, okay. And you reward them with little stuff, candies, well, not supposed to have candies, but little things that they like. And they build that boost, that confidence, and you have that relationship. I'm like Auntie Marsha. Everybody knows me as Auntie Marsha, because I have a built relationship with my children from here to up here. And for me, communication is key. Communication is key no matter what. And trust me, you'll see the works. Trust me on that.
Thank you. Any questions for our panel so far? No? You guys still with me? Still awake? Do we need to stand up again? Hands up? Down? Out? Nobody's moving. Marsha, make them do it. You should say.
Oh, speaking of wellness, just in case you did not get an opportunity to receive one of our discount cards, just to take care of yourself, to pamper you, we want to say thank you to you guys for taking this opportunity to come here and to learn more about how you can impact your children and those you're teaching, and so we're giving you a 20% off any service. So if you have not received any, please put up your hands. Felicia will come and give those out for you, or I can take it to you. All right?
Thank you.
Okay. Any final thoughts from the panel?
Parents, you're doing a good job, okay? You are. You might feel like I'm doing something wrong because you might shout this time. It's okay. You go back and say, I'm sorry. Use the word sorry a lot, because you expect our kids to say sorry, then you have to say sorry too. But you are doing a good job. I keep up the good work.
Thank you. Thank you. So I'm going to challenge each of us, if you're feeling brave enough to do it in the audience, because I know we have teachers in the audience as well, I'm going to ask the panel this question. If you could have every parent and teacher remember one kind word or phrase when working with a dyslexic child, or any child with a learning challenge for that matter, what would that kind word be? Just think of one word, or okay, it could be a phrase. It could be a phrase, yeah. Okay.
I am enough. I am enough. One phrase. I am enough. Even as adults, sometimes we don't feel that we are enough, but you are enough. You never get anything. I say it this way, God never give you more than you can bear. I am enough.
Thank you.
I would say I can do hard things because you can.
Thank you.
I can keep trying.
I may not be able to do it as yet, but I will get it done. So the power of yet. I cannot do it yet. I do not understand yet. But we're going to get it done.
I like that. I like that. Thank you. Any from the audience you want to share? I know some of you are out there. Don't let me start calling names. I heard Margaret. Margaret has something to say. Margaret, put up your hand so we can give you the mic. She's
I'll say it for her. You're not alone.
You're not alone. Thank you. Apostle, you have any? A phrase, a word? Put up your hand so they could come to the mic.
There we go. I guess something I do with my daughter, I'm loved, I'm valuable, and I am important. I'm loved, I'm valuable, and I am important. Again, affirmation, daily affirmation is something that I'm big on. Encouraging yourself, speak to yourself. Nobody's as good as you. I can do all things. I'm the head and not the tail. I do a lot of Christian confessions and declarations, affirmations.
Thank you. All right, well, I would say thank you to the panel. You guys did an amazing job. Thank you. Let's give them a round of applause. Oh, you have one more? Sorry. Sorry, we have one more.
We're in this together.
We're in
and
this
above
together.
all, we have God.
Thank you. Thank you. Thank you, panel, as well. You guys did an amazing job. Okay, we'll take a quick 5-minute break for the moderator. Be right back. Now, she has rheumatoid arthritis and she's All right, so our next panel, we've heard all of the good things already today. We learned a lot about ADHD, dyslexia, as well as how we support, through play therapy, our children living with autism spectrum disorders. So now we're gonna pivot a bit to some of the things that are happening in our community in terms of support, our BVI initiatives, because I find sometimes people are unaware of what's happening, and there's a lot happening. So I picked three key people who will speak a bit about what's happening in education, what's happening in social services, and you're gonna hear from one, well, it's more of on a private citizen basis in terms of what's happening in one of our private schools and one of our projects that she can sit on right there with you. Yeah. So without further ado, do you have a plastic bag with you? Yeah. Is that your presentation? Okay. All right, so, okay, great. So now we have the principal of that school with us, Ms. Alfreda. Welcome. All right, so Crystal, can I start with you? Yes? All right. So tell us a bit about what's happening in disability services. Thank you. Clearly it's after lunch. Tell us a bit about disability services as the director there, and what are some of the services our community can access.
Okay, well, good afternoon, everyone, and thank you for having me, Simone. So when Simone reached out to me, she said, I want to know what support services we have available via social development and disability services. And I was like, what? That's a lot. So I'll try my best to make it as brief as possible. Within the Disability Services Division, we offer various services, which would include assessments, intervention planning, intervention support, case management, care coordination, family support. And through other programs under the Social Development Department, such as the Public Assistance Program, then we're able to help to support our clients also in financial ways depending on their needs. So when it comes to all programming within disability services, we have our early intervention program, which services individuals between the ages of 0 and 8 who are displaying developmental delays. So when we speak about developmental delays, we're talking about children meeting various milestones at the time that we would generally expect it to occur. So children we would expect to maybe be walking around the age of 1, potty training around 18 months, 2 years to 3 years. And so if we're seeing delays in this, delays in when they're having their first word and things of that nature, then we try to provide services as soon as possible to help them to develop those delays, develop those skills so that they can be able to now transition into schools and be effective in learning, right? So that's our early intervention program. And then we have our autism program, which we have kind of expanded to not just focus on autism, but to focus on different disabilities that individuals can have. So that does include different neurodevelopmental disorders, like how we're speaking about ADHD and dyslexia today. And so when I mentioned that we have a variety of services, it might not be that they're getting that intervention support from us, but maybe we're helping to partner with different agencies or collaborate in getting them the support that they require. They might have sessions by us, but it also might be a case where we get them onto somebody that can assist them, we get them referred to speech therapists, and we just ensure that they have a whole holistic type of services provided to them and their specific needs. So then we also have our BVI services program, which is for adults with disabilities, and that's a day program where they come daily and we help them to develop different life skills, vocational skills, so that they can be as functional as possible. And we're also in the process of developing a program further. We currently are providing support to individuals, for example, who are at the college, just trying to help them to integrate. And we have one client that was coming to our day program that's now employed full-time. And so those are the things that we're working towards developing within our programs to make it more supportive from a broad perspective, helping them to be functional, helping them to be included, helping them to be independent, and being, self-sufficient. So I think I might have touched on everything. Oh, we have job placement program as well. So our job placement program for adults is a program where we would match our clients with different employers, and they would have a period of maybe 3 months where they're working with that organization, and we would pay the salary for that period of time, and then hopefully the client can gain long-term employment with the employer. And so making a little plug here, if you have a business or organization that wants to be progressive, you can always reach out to us so that we can partner and get our clients to be included into society, because we are having a continued challenge with getting our clients placements, and we're having challenges with people actually keeping them on. And, we have a lot of talk about doing things, or a lot of us want to appear as if we are supportive, but when it comes time to actually being supportive as a community, we're not doing all that we can do. So that's my little plug. If you're interested, not only with our adult services, but also our early intervention program, or autism programs, if you want to partner, if you want to help, if you could think on anything that you think would assist us, you could always reach out. We could have a conversation, and we could see how we could collaborate to make the community more supportive to all populations.
Sounds good. Thank you. Before you go, though, I have one question, but could Cornet Hamilton make your way to the registration desk, please? Thank you. Cornet Hamilton, is it? Hamilton. Thank you. All right, so my question to you, Crystal, is how do we access these services?
See, I forgot something. That was it. Yeah. So in order to access our services, because Simone made sure to tell me this is very important, which is true. So in order to access our services, yes, we are the Disability Services Division, but we operate out of Social Development Department. So you have to make contact with the Social Development Department. We have 2 locations. You can go to the main location at Botanic Station, and you can make an appointment to have an intake assessment. And making an appointment is very important, because that's where we get the basic background information on the client's recurring services, and that's where we capture that data as to how many people require what and what are the needs of the community. So it's very important for you to go there first, get all the basic information, and then once you do that process, they will send the files over to us, and then we'll do all more intense assessments from there.
All right, and this is something that follows the person for their lifetime, right? I mean, once they're in the system, they're in, and then you have a file number or something, and then you can access as you progress. Right, ladies over there? I'm looking at you. Yes?
Yes, my disability services crew.
They're right over there. So if you guys have questions, they're right here today. So go find out how to start accessing some of these amazing things.
Because like I was saying, we have different programs targeted towards different age groups. So for example, we have our early intervention program. We might provide support there. And then the child might become school age. They might have a little transitional period and integrate into the school system. And then sometimes we get people presenting again because different challenges are coming up now, and so we try to offer support. So that could be while they are in school, so now we're offering additional intervention services. That could be, like I said, we have 2 clients currently attending college, and so now we're assisting them on a weekly basis, or even when they're exiting maybe Eslen Henley or secondary education, and they come to our program, and we could help them to build those life skills, employment skills, so that they can be fully functional.
Amazing. Guys, it's out there. Just go find these guys, and they'll help you. Or at least they'll point you in the right direction. Just a little bit of disclosure. That's how I got started on this journey. Somebody said to me, go find Miss Dawson. And guess where she was at the time? Right there, Disability Services. So thanks to Miss Dawson, who's sitting over there. I was able to continue building on my daughter's support through various committees. And so when they're finished with you guys, you mentioned then there's the education element. So we're going to pivot to our amazing Mrs. Afia Smith, and you're going to tell us a bit about what's happening in education.
Good afternoon, everybody. Good afternoon, everybody. Oh, I wonder if you're sleeping on me. All right, so before I go, I want to ask 2 questions. If you're a parent in the room, raise your hand. Okay, it's a lot of parents. All right, great. If your child attends public school, raise your hand. Okay, that's 2. And the others will be private schools, right? All right, great. So we have a cross-section of persons within the room, which are great for me to segue into what I'm going to say in terms of where we're at in education. So we're in 2025, and it's a different era in education across all sectors, both public and private. Things are a little bit different than we're accustomed to. We're now more inclusive system across all school areas, and because of that, we applaud you parents for entrusting your children in the care of the education sector, whether it's public or private. I know it's not always the easiest. I know sometimes it's difficult, but we thank you for being our partners throughout your child's education journey. So when it comes to education, I would always say a lot is going on. There's no down day when it comes to children with neurodivergent needs in our system. There's never a down day. So because of that, we are constantly evolving, constantly coming up with new ways to meet the needs of our students, to integrate them well into our education system. One thing we have done this school year, we have started transitional visits for secondary students. In the past, we only focused on preschool to kindergarten. And we know, I was listening earlier, and I heard Apostle Foy spoke about transitions and routines and so forth, important. And we saw the need for doing it at the early years. But as the needs moved up the ladder of education, we saw that it was also important at the secondary level. And so this year, we have started integrating our students earlier by having transition visits to see the facilities, to see the instructors, to get a layout of the facility, whether it's on Sister Island or on the main island. And it has helped our children tremendously. I would say this school year, it was a bit smoother of carrying them from primary into secondary. So I'm always saying that's something that we're proud of. Was it easy? Of course not, but we're very proud that our students were able to matriculate into secondary a bit easier this school year. Our early intervention services and programs continue. We work very closely with disability services. We don't do anything in isolation. So any student that is identified from the early years that are getting ready to transition into primary, we partner with them to make sure that services, information about their needs are carried over in a timely manner. We have also done a lot of work on training our teachers. I see today we have quite a number of educators in the room, and I'm sure they can attest every year, and I can attest, once my name is on a schedule for a session, everybody wants to come to my sessions, which is a good thing. Shows that our educators are interested in learning how to better meet the needs of your child or children. So parents, know that all is not lost. The educators are interested in knowing how, what, why. Is it easy, educators? All right. No, but we still do the best that we can to meet the needs of the students that come within our care. So training continues. We are hoping to put out some certifications for educators in different areas of special education. We have also been able to acquire a management platform to kind of track our progress monitoring of our students. We're still rolling it out, but it's in the works because, again, we're in a new era, we're in a technological era, and we want to make sure what we're doing is accurately documented and that we can relay that information back to parents in a timely manner. So we've been working on some new initiatives throughout the last year. When it comes to children with any sort of disability or challenges, we have our procedural framework that we've been working with for a number of years to help us take them through the journey of education, from identification, referral, to assessments, to giving the relevant documents, whether it's an intervention and individualized plans, and those documents carry the child throughout the entire academic journey. One thing, just like disability surveys that I am personally proud of, I think I could retire on this, is that we have formulated certification programs for exiting students. Now, everybody learns different. Everybody is not on the same wavelength as it, but again, we don't always see their challenges, we see their strengths. So if you're good at something, we kind of push you in that direction so that your success rate is higher. So for the last 3 years, we have been able to graduate secondary students who have challenges or difficulties, but they were able to graduate with their classmates, receive certification, and are currently successful adults in our society. They're not in jail, they're not just home sitting down, they are meaningfully employed, and one of them is in university away. So we have done some serious work and I applaud my secondary educators. I know it's always a challenge, but they put a lot of work in making sure, and like Ms. Estridge, I'm putting a plug out for employers. We do have our apprenticeship program at the secondary level. Their last 2 years of their high school journey, we attach them to work-related skills so they could get in the rhythm of being a productive adult. They know what it is to show up on time. The employer gives us feedback for the school and things we need to help them with, or the child needs to improve on. And it is our hope that as they leave, they could continue on with those establishments. And my last plug is for our Esden Henley School. We're officially opening on Monday, thank God. It's a long time coming, and again, just like the secondary level, we have also included apprenticeship for them. And this year, the graduating class students, 2 out of the 3 are fully employed. So again, we're doing a lot of work to integrate them into society. We're not just doing it from the educational standpoint, we're looking at them as a whole person and making sure that when they leave education, it doesn't stop with what we have given them over the years. So we partner with all agencies to make sure that things are flowing cohesively, and we just encourage parents to continue to partner with us and assist us where need be to ensure that the students indeed become lifelong learners and productive citizens of these beautiful Virgin Islands.
Aren't they amazing?
Wow. So much is happening in the public service. So let's not lose hope. I know it's not always perfect. I know it's not always easily reachable, but we're tenacious, right? That's why we're here today. It's raining and we're here because we're gonna keep pushing. We're gonna keep trying because that's what we have to do for our kids. If, as someone always says, if you don't do it, nobody doing it for you, right? Okay. So, all right. Next up, we have sort of a, what do we call this particular segment, Mrs. Wheatley? A briefing. All right, let's go with a briefing. We're gonna have a briefing with Mrs. Alfreda Gordon Wheatley. She's the school principal at Agape School. Now, a little bit of backstory for those who may not know. Lemonade has recently partnered up with the first school, I think this is our first official partnership, with a school in the BVI that reached out to education. They reached out asking, they said, look, our population is growing, our teachers are a little bit out of their depth. How can we get better? How can we help these students? What do we do? And persons reached out to me and said, hey, Lemonade, you're up. And we did. We stepped in. We did a training program, a 6-week training program with the teachers, and Apostle Foy sat in on those with us as well. And then during their professional development week, we had a day of a full inclusion workshop, just getting them ready for the new school year and the students that are there. And this is all part of the ultimate outcome we were attempting with, we're piloting with this school, which is to have a sensory room integrated into a standard school system. And the school embraced this with open arms. They gave us a classroom. They said, all right, there's your blank canvas. Let's do this. And we did. And so now at Agape Total Life Academy, we have the first, I know I've been getting a lot of flack about this statement on social media, but yes, I will stand by it still. It is the first school, that is a lot of caveats here, first standard education school in the BVI with an exclusive classroom for their neurodivergent students. How about that? Did I do okay, I feel? I'm saying this because obviously we have Eslyn Henley, obviously we have Ines Adams and a TK program, obviously we have a lot of schools really trying and doing a lot. It's not to diminish any of that. It's just to say, when we see a school step up, let's big them up, let's commend them. So, ladies and gentlemen, Ms. Gordon.
Good afternoon, everybody. My name is Alfreda, and I represent Agape. I am the principal. I have been assigned September, and I am glad to be a part of this, and I'm glad to be the principal of Agape, and also coming into an environment where neurodivergent students are greatly embraced. I know that different institutions turn them up. I have been where I've heard people say, no, we don't, but Agape embraces neurodivergent students. And because of the dedication of Mrs. Foster and Lemonade BVI, our school was able, as she said before, to receive its first sensory room. This sensory room helps students who learn differently cope and teachers with challenges that you normally face in a regular classroom. And one of the things that I recognize that works for Agape is the population size. Agape is not overpopulated. The teacher-to-student ratio, it's good. And because of how good the teacher-student ratio is, we have, I would say, we have one of the largest neurodiverse populations in the BVI. Because our school population is small, but we have a large number of neurodivergent learners. And we try our best. We meet with our parents and we work on plans. So our neurodivergent children, they have plans. And we have a schedule that we follow. And whenever our children are having meltdowns, because they do have meltdowns, they do have challenges on a daily basis, and the teachers have been trained how to cope, how to deal. We understand that putting them in a corner or ignoring them and all of that doesn't work. We understand that they need something. They're trying to tell us something. And something that I realized, not even recognizing before I became the principal, that this would be important. I like to watch some of the Facebook reels, and I saw a mother showing her neurodivergent child, and she was saying the child was acting up. People would look at it if she's in a supermarket and so forth as she's not disciplining the child, and that's why the child is behaving how the child is behaving. And something simple as the tag touching the child's skin, irritating their skin, but not knowing that for us, tags touch us all the time and it's fine. But for some children, it's a problem. Or even the type of material clothes is made out of, cotton, linen, etc. They irritate the children. But if you're not knowledgeable about these things, you would see it as the child being defiant, or the child doesn't know how to behave and sit still. No, the child is trying to say something, and maybe because they are nonverbal, they're not able to express the way we express. And at Agape, our teachers, because we have a wide population of neurodivergent students, we are definitely able to pick up on cues and signs. And that sensory room, it's a God-sent room. If your school doesn't have a sensory room, please bug your principal and your administrator to get one, because we use our sensory room every day, Monday to Friday. So training, getting your teachers thinking about embracing change, it's definitely necessary. If we continue to shun away and turn away parents, then the population that we're seeing will be left out and we wouldn't be able to reach them. But we have to make sure the first thing we need to do is first train our teachers, and then when our neurodivergent learners come, we are more able to cope and deal with them, because we understand that they are not willfully doing something that we are thinking, or some people may be thinking, they know better. No, they don't know better. Something is happening and we need to see and address it. As Miss Afia said a couple weeks back into another presentation, she said this is not going away. It's not something where, yes, I remember that, and I love that slogan. It's not going anywhere. And because neurodivergent learners are not going anywhere, we have to embrace them into our classrooms. Therefore, we can't have one teacher to 18 to more students and then having a neurodivergent learner in the classroom, or 2, or 3, or 4, and expect to get results. These neurodivergent learners, they need attention. They need a tailored daily routine task assigned to them, as well as when you're still catering to the other learners. And so if you have one teacher to so many children and a packed curriculum, it won't work. And as I said earlier about the sensory room, our sensory room has in many different things inside of it that caters to our neurodivergent learners. And I know you asked me to my Clarence Thomas bag. I did not go to Clarence Thomas today. I just happened to walk with some of the things that Lemonade BVI and the team donated to our sensory room, just to give you all an idea as to what type of things are in the room and what kinds of things helps our learners calm down, cope. Time is very important with them. You set boundaries, you give them a time limit, you let them to see, things up there. You put up something, or you put the stop clock, and you say, we're going to be in there for 5 minutes. Give me a second. So if we tell them we're going to be in there for 5 minutes, set your clock, let them see it. Let them know you mean 5 minutes, and they're able to see. Because some of them do know their numbers, they can cope. So once they see this and they know the time is up, they know we're heading back now to the room. Because trust me, the room is so fun, the room is so cool, the room is so dark. Those children want to stay in there all day, I myself. So we have to remind ourselves, we have to pull back. And we're not on a planet by ourselves, because when you're in there, you feel like you're in a planet, on a planet all by yourself, because there's no noise or anything distracting you. So we have to make sure of that. So we have lots of different, this thing is very heavy, it's very weighty. It's like a mat, but you let the child, you place it on top of the child, whether on them, their shoulders, or on their lap. It helps them to calm and to soothe themselves. And you see how beautiful it is. It's pretty, it's shiny. The child can still touch and play with it. It's very weighty. I wouldn't want this on me, but they love it. The pressure, yes, the pressure. Then we have different little types of locks, different styles for them to unlock, put back together, etc. It's fun, yeah. It's creative. It helps them to forget about the tantrum that they were just having and to refocus. The sensory room is for them to refocus. We have the different, it's just water colored, food coloring with little obstacles, different trinkets inside. And this alone, some children who likes water or who likes bubbles, this here would just calm them down, they shake it up a little bit, and they're good to go. So in our sensory room, we have many different tools, of course, plush animals that they can squeeze and throw and so forth. The mirror, the big mirror to see themselves. We have the chair that they can go around. They have the mat they can bounce on. They have the light up. You plug it in and it bubbles up and it bubble tube. Those children and teachers don't like to come out of that sensory room. You have to go and look for them and say, hey, hey, learning needs to happen, right? But these are just some of the, and the emotion chart. We can use this chart and let them tell you how they are feeling, especially the nonverbal children. They may not be able to say it, but this chart helps them to see how they are feeling. So I just walked with some of our donations because I love Lemonade and the gang. And with catering to the children's needs, they come back. They pull back together and they are ready to go again. So it is very important for us to understand our role. It is not for us to judge. We didn't come there to judge the children or the parents or what they didn't eat and so forth or what went wrong. It is to just help these children move from point A to point B. Of course, we know that every child would never do algebra. But we know that every child can learn. We are just trying to transition them from one place to the other place. And that is our job at Agape. We are trying every year, every term, to move that child up further. We are expecting at the end of that term, that academic year, that the information that child came in knowing, they're leaving better off. And the teachers, as I said, understand that because of the plans, because of what we're doing with our sensory room, because of the teachers' understanding, and also allowing the other students in the school to understand that not everybody looks the same, functions the same. We have to educate them. We have to help them to be sensitive to others. Sometimes children don't understand things, and it is okay. But once we educate them to embrace others who are different, then we all can live together. And that is definitely one of the biggest keys. At our school, the regular students, or what we call regular, don't bully the neurodivergent students. They look out for them. If I tell them go down on the playground, they are waiting for the neurodivergent child and saying, let's go, we only have 5 minutes to go. And when playtime is over, they tell them, let's go, teacher, call us. They don't abandon them. So we have to still teach love and compassion through it all. They are not going to do the same work, but everybody will function together in this space. Thank you.
Thank you so much, ladies. I can't underscore the value of the work that you're doing. I think on behalf of all of us here today, we just want to say thank you. And I know you've got your teams and you're working diligently to get this work done. I guess the voice is going now. But I just want to truly commend you all for stepping out and doing this every day. You wake up every day, but you have your own challenges to deal with at home. But you come out and you do this for us, and we truly appreciate you. So thank you. All right, so let's show some gratitude, guys. Let's yeah. All right, so just very quick one. We're at the end of our presentations for today, and I just want to say, I just want to give one final plug, and because this is something that I experienced personally, and I know this symposium is for everyone, but I feel like I need to make it about me for a minute. Just this week, or was it last week? It might have been last week. It's all a blur. At least within the past 2 weeks, what I experienced was a shift in behavior in my daughter's school. And this happened, unfortunately, because she was having a really hard time with what we would call a bully, right? Because of what I do, because of what we do together, I had to shift my perspective on how I deal with this. It wasn't like that at the beginning, because you guys remember me ranting and raving, right? However, we got to the place where we know this child is going to shock you what I'm about to say. This same child that was bullying my child, it was Monday, last Monday. My daughter got to school that day, and she was having a sensory overload. She had a really good weekend, and she didn't want to go back to school, because, you know, how many of you had a really good weekend, and Monday is just like, no, I'm not going to work today, yeah? Imagine that with an autistic child, it's like 10 times worse, that she just didn't want to go to school. However, the student that got her out of my car was that student that was bullying her a year and a half ago. She came to the car and she said, what's wrong with her niece? I said, yeah, she's having a hard time today. Can you help encourage her? And no, I know this child is receiving help now, or at least somebody's talking to her about neurodivergence, because the way she spoke to her, there's no way she came up with those things on her own, and she helped her out of the classroom. So I share that story not just to highlight that, you know, my daughter had some situation. It's just to say, we have to encourage everybody else outside of this circle. We have to encourage the neurotypicals, as they call them, the children who don't know what neurodiversity is. We have to encourage the parents, right? And I noticed what I'm just going to call you first name, Elfrida said earlier about the students at Agape. They are enlightened. Even if they're not neurodivergent, they understand that there's somebody different, and it's in growing that difference and that understanding that helps them to support their peers who may be struggling with things that we don't struggle with, okay? So it's really important. It's good for us to be in this space together, you know, raising awareness, putting it out there, supporting each other, but we have to get others who don't live our experiences to also understand, because there isn't going to be a world or an island or a country where only neurodivergent people are there. We're all mixed in together, and so we have to learn to live together. And it has to start in the classroom, and it has to start at home. So I would just keep encouraging you, and to those of you out there listening, please try your very best, because we're trying to. So try your best to understand what's happening and understand that it's a different experience to what you may know. These children are not bad. We're not bad parents. We're all trying. Teachers are not bad teachers. Everybody is trying their very best. And so let's give a little bit of grace, all right? So I will leave you with that today, and I just want to thank you all and thank the panel again. I do have vote of thanks to do, so you're going to bear with me. And you're going to sit and listen to the vote of thanks, because I have some giveaways for those who were listening today. All right, so very quickly, thank you. Or you can stay with me. You can stay with me if you want. I know you like my company. Your phone is under there. Yeah. You see it? Okay. All right. So just very quickly, just on behalf of Lemonade BVI and our organizing committee, it's my great pleasure to extend a heartfelt thanks to you all and to everyone who contributed to the success of this symposium today. I especially would like to say a sincere appreciation to our panelists, Dr. Jardine Turno, Dr. Josephine Claxton-Richardson, Apostle Colonel Foy, Dr. Mike, Dr. Connie George, and all the other professionals who shared their experience and expertise today. I'm not going to list all the names. We had a lot of speakers and a lot of presenters, and we appreciate you all. A warm thank you to our sponsors. You see their logos are on display there: Caribbean Insurers, Speech Therapy Services of the Virgin Islands, Maples Group, Therapy to Thrive, and Ernst & Young, or EY as they're called. I also want to give a big shout out to Speedies and Coralie for once again helping out my VG folks and getting them over here today. They came over on the boat free of charge. They did not pay anything, okay? So Speedies, big up. Also, we want to recognize Save the Seed Energy Center for hosting us in this very welcoming space, and for the hard work of my team, my dream team. A lot went on behind the scenes to make today possible. So I want to thank my team, the dream team. You guys come on, stand, wave or do something if you still have energy so they can see you. Yeah, see some of them over there. All right. Thank you all. And to you, our attendees, thank you for coming out today. I know it was hard. I wouldn't want to stay in bed today because it's nice and cozy. I know some people did, but that's all right. I thank you for coming out and participating and being here. And to those watching online too, thank you for tuning in, spending these hours with us. It's really, really important to us that you're a part of this. So as we close, let's carry forward the message about neurodiversity, that it's not a limitation, but a spectrum of potential. Together, let's keep building a community that supports every child, every parent, and every individual to thrive. I would like to say also that for the teachers here today, we have your participation certificates are in the back so you can get your PD hours. So it's back there by the Gratitude Center, the Gratitude Table. And for those of you from Virgin Gorda who need rides back to the ferry terminal, just please check in with registration desk. I think it's about 12 of you here today. So Victoria, I believe you're coordinating that over there. And I just want to thank you again for getting on the water and coming over today. That's really cool. And thank you all once again, and we look forward to seeing you again at next year's symposium. All right. So we had some massages happening here today, right? You guys, how many of you had massages? Let me see, put up your hand. If you could still raise them, because you probably want to go sleep now. Yeah? It was amazing, right? Those ladies, yeah. So guess what? We have some gift certificates from them. So if you want more, you have to answer these questions. We have some questions. Actually, I'm going to ask my team. Anybody have a question from today you want to ask, especially the presenters? Let's see if they were listening to you. Tilly, do you have a question? Let's see if we can get somebody to win a prize. Okay, while Tilly searches for her notes, I will ask, does anybody remember how many points. What was her name? Jen. I just called her Jen. Oh, yeah, not a question, not that one. You were all listening. Well done, well done. It was 12. Okay, it's not going to be that. Tilly, do you have a hard one for them? Is dyslexia a lifelong condition? All right, we have somebody here. Yes, it is. All right, come on up. You get a certificate.
Thank you very much.
All right. Anybody from the ADHD section has a question? You want to ask? Panelists, they're gone? No? All right. How about Dr. Josephine? You have a question you want to ask them? See if they were listening to you.
Can you where did Miss Monroe and I come from today?
Let her finish the question.
Correct.
All right, come on up. You win. Come on up. I didn't hear the question, but she obviously knew what it was. Where did they come from? Oh, okay. All right, come on up. Get your certificate. Okay, and
Since we were talking about the symptoms of ADHD, what is the minimum amount you're supposed to have to make a diagnosis? So you got a prize already.
okay, I don't know who said it first.
She put her hand up
Ask
first.
another question.
She
Who
put
said
her
it
hand
first?
up first. She put her hand up first.
Put her hand first.
Yeah.
Okay. This one, okay, come on up. It looks like Virgin Order taking away all the prizes today. Well, all right, that's it. All right, so we have a few more minutes, and if you haven't visited the resource tables yet, I'd encourage you to make your way over there, speak with our specialists, and enjoy the rest of your afternoon. Thank you for coming.
Everyone.